Bwrdd and croeso to our board meeting. Before we start, I would like us to spend a few moments, remembering the Holocaust Memorial Day, which is today, and which marks the liberation of Auschwitz-Birkenau, the largest Nazi death camp in occupied Poland. Today is a day for us to remember the 6 million Jewish people murdered in the Holocaust and the millions of people killed under Nazi persecution and in genocides that followed in Cambodia, Rwanda, Bosnia and Darfur. This day reminds us that we all have a role to play to ensure that we learn the lessons of the past to create a safer and better future for us all. Thank you, everybody. We're now going to go into our public board meeting. We have apologies from Mrs. Ros Jervis, our Executive Director of Public Health. Do we have any declarations of interest? No, thank you. Okay, we'll go straight on then to the minutes of the public meeting held on the 25th of November 2021. Are there any amendments or inaccuracies that members would wish to raise? No, thank you very much. So we'll then go to the table of actions. Are there any things that members would wish to raise?
Can I just raise my first action on there, please, Chair, around a meeting with HEIW? Just to confirm that members of the team did meet with representatives of HEIW yesterday for a preliminary meeting, and I have a follow-up meeting next Friday. So we will be able to give a verbal update to the People Committee as planned.
Oh, that's good to hear, Lisa. Thank you very much. If I could then go to the, it's on the same minute reference, PM 21191, which is the workshop that we discussed at our last board meeting about working together to look at ways in which we can provide social care.
I can update on that, Chair.
Thank you.
Just to say from the progress we've made, we've got a planning date in the diary for the 10th of February with Jill, the director, and a number of other people. At the moment, my office is trying to get a hold date in for all the people we'd like to invite to the workshop, which we're guessing, because these are busy people across our partner organisations and internally, it'll probably be end of March, beginning of April.
Thanks, Steve. Judith, did you want to come in then? Judith.
Thank you. I did just put a response. My question was the one that Lisa covered at the start, so thank you.
Thanks very much. Has anybody else got any questions on the terms of the action log? Okay, I have two, and it's PM 21 200. When will we have the revised timescales? And that's the engagement with the traditionally hard to reach groups. Lee, and then also, when will the boards hear about the ideas around the composition of the public panels? That's Lee, Chair. Thank you. Thanks, Lee.
Yeah, happy to take both of those. So we've developed a draft plan initially around the continuous engagement and the hard to reach group in particular within that. So I'd like to bring it back to the next board, if that would be okay, Chair. Quite happy to do that, and obviously we'll take that through committee as well at the appropriate point. On the shortlist appraisal group, we took a proposal to executive team yesterday, which was supported. So again, we'll pick up the land item under my PBC agenda item, but again, happy to bring that back to board at the appropriate point. That may be the next board, but we just need to work out timings around that, if that's okay.
Super, thanks, Lee. And then the last one I have on my list is PM 21 211 in relation to when the plan regarding endoscopy will return to the board. Andrew.
So I take that, Chair. So we've had an initial conversation earlier in January with Swansea Bay about developing a regional approach to what the opportunities might be for a regional approach to endoscopy. We're planning a workshop now with the support of the Arts Programme team, which will probably take place towards the end of February, early March, to work that through. So I think after that workshop, I'll be in a better place to advise on the timeline for developing a proposal, because a lot will depend on what comes out of that session with the respective clinical teams and services.
Okay, thank you, Andrew. Is that best coming back here, Joe, or to one of the committees?
Probably what could go to the planning committee maybe, but we can put that as an action and work that through.
Okay, that's great. Thanks very much. Thank you, Andrew. Okay, thanks everybody. I'll go now on to my report. My report is before you, and so I won't go into it in detail, but I'd just like to add to it that Steve and I visited the new special care baby unit last week. It was beautiful. A beautiful facility for babies and families who need special care in West Wales, and it actually opened on Tuesday this week. When I became chair about 2.5 years ago, I was at one of the first places I visited was the old unit, and I was really shocked at the conditions. The care was tremendous, but the facilities were not fit for the purpose. So it's really wonderful to see that we've got proper facilities for babies in need of special care in West Wales. And it really reinforces why the programme business case, which we're going to consider further on in our agenda today, is so important. You know, we have an ambition to bring all our sites up to that standard. So I'm really looking forward to the debate on that. I'd like to draw your attention in my report to how we are capturing the views of children and young people on their experience of health services here, so that they can play an active part in shaping the design of in the future. And the board has also been considering, as you can see in my report, some of the excellent work that has been going on to improve our culture. Unless you get the culture right in any organisation, other things don't work as well as they should be. So we're really proud of that. And I think it's also important, especially after the last 2 years, to reflect on some of our successes. So I've outlined in my report how the nutrition and dietetic team were named as the top screeners in the whole of Wales for malnutrition, and also Withybush Hospital winning a silver award for the most innovative use of the reminiscence intervention therapy achievements on Ward 12, working with dementia patients. And you can see listed in my report all the people in our board who won a Chairs Award. Such a massive range of people from lots of different parts of the organisation who really go the extra mile. And I'm also like to finish to say that I'm absolutely delighted to confirm that the Minister of Health has reappointed 3 of our board members, Maynard, Davis, Anne Murphy and Anne Lewis. So really glad that you're staying with us for the next part of our challenges and our journey. Diolch. So I'm happy to take questions.
Dylan.
Dylan.
Diolch, Chair. Diolch. Bwrdd da pawb. I'm just wondering if you can expand on the feedback, gathering the feedback of children and young people. And it does mention other services, but can I check that it will incorporate primary care, community services, especially PEDS, and mental health and learning disabilities, please?
Thanks, Dylan. I think Andrew's going to come in on that. Andrew?
Yeah, happy to help answer that question, Chair. So, as you know, previously our feedback mechanism targeted the inpatient ward areas. This has really extended that targeted focus towards the emergency department and paediatric ambulatory care unit and outpatient services. We haven't yet specifically targeted some of those other services you've indicated, although through the social media campaign that accompanies this, everyone of the right age is encouraged to complete a questionnaire with following any access or contact point with our services. If the board would like us to take a more targeted approach to some of those other services, then I know the Directorate are more than happy to progress that and take that forward as well.
Thank you, Andrew.
Thank you.
So Del, were you happy to connect in as well, and everybody with ideas? That would be super. Thank you.
That's great. Thank you very much.
Any other questions?
Chair, just popped to know in the chat bar that Professor Gamble's still having IT issues, but he's asked if we could possibly just provide a quick overview of the positive work in relation to culture change, because he knows how important it is to the board. So just wondered if Lisa could maybe just provide an update.
Thank you,
Chair.
Thanks, Joe, and thanks, John. Lisa, would you like to come in, please?
Yes, of course, and thank you for the opportunity. Part of the work that we are doing in terms of culture change, as you know, is that we have introduced a range of relationship managers. They are now developing people and culture plans across each of our directorates. There is an assigned individual that works with our management team around those plans. So this will be about our future talent, how we engage with people, and how we support people through informal mechanisms as opposed to formal mechanisms. We also have a comprehensive suite of leadership development programmes, and we will be showing at our board people committee in the next couple of weeks our first.
Lisa, you've frozen for.
Introduced, which is later on in the papers today, our first monthly staff survey, where we're aiming to survey every member of staff or give everyone an opportunity over a period of 12 months, and that's by surveying 1,000 people a month.
Thanks, Lisa. And the board were really assured, as was the people committee, about the work that's being done. Innovative, it doesn't do it justice just speaking at a board meeting, but I know it really is making changes out there, so thank you very much for supporting that. Okay, thank you. I'm going to ask Steve now to give us his report.
Yeah, thank you, Chair. And if I can just add my congratulations to Anna and Maynard. Great to have you staying on board with us. Really good news. Just a couple of things I wanted to highlight from my report, and then one thing that's happened since it was written, just to bring to board's attention. So the two things was, firstly, the joint executive team meeting that we held with Welsh Government colleagues, the new Director General, NHS CEO. It was a really good opportunity for us to update them and put on record actually all of the work that we've been doing in response to the pandemic that we have discussed at many board meetings. As they recognised that we were a place that always sought innovation, that was coming up with novel solutions to problems. And actually that's something which I think has really characterised our approach to the whole pandemic. And they were particularly interested in things like our enhanced bridging programme and our single point of contact for patients. They were also interested to explore more and understand more what we're doing around the social model for health and wellbeing work, because they see that as a really important feature of the future, which we are leading on. So I'm hoping we'll be able to. I've asked if we can formally have that as an agenda item for our next JET meeting, so we can talk in more detail. The second thing was just to highlight the joint narrative around our ART partnership, one of our important partnerships in South West Wales. The intention being that this joint narrative, once agreed, sets the principles by which everything that we do will follow. I have to say we've been following those principles anyway. I think they've been inherent in the whole approach, and we will then include it in our IMTP going forward, so that we have a clear way of working together. But I think our partnerships across all of our boundaries are stronger than ever. The last thing I just wanted to bring to the board's attention was a recent review by Health Inspectorate Wales regarding our learning disability and autism residential services, a particular facility. The report is on the website, and I know it's been shared with board members, and does highlight concerns with the environment and some staffing HR issues. I will ask Mandy, with your permission, just to give an update on where we are with that, but we've got an action plan. That action plan has been agreed with Cyhoeddus, and that will obviously go through the right committee, the Quality and Safety Committee, for overview and assurance. But it did give me an opportunity just to update the board on the the work we are refreshing, which links actually to the question that Professor Gammon asked of Lisa around the wider leadership and culture work that we're doing in the Mental Health and LD Directorate. There's a review underway, there's a meeting tomorrow, and a plan is coming back for discussion executive team next week. What I was keen to do, again with your permission, Chair, is to bring back a much fuller report in March, which actually addresses all of the work that we're doing on our planning objective 5G, which is the rollout of our transforming mental health strategy, the rollout of our transforming learning disability strategy, and the waiting time work that we're doing around autism and ADHD. I think it might be a useful wrap up of a whole range of issues that are going on, and there is some really good work going on in mental health and LD, and I don't think we've had an opportunity with all the other things going on in our acute services to really explore that in detail, whilst recognising it has been going through committees. So I wonder if Mandy might want to give an update on the specifics of that report. I'm happy to take any questions.
Thank you, Steve. Mandy.
Yeah, absolutely. And thank you for inviting me to comment on this. I think probably it's important to start by saying that whilst the report identified a number of areas that clearly need improvement, the unit concerned is currently closed, and it was closed immediately in timing with the inspection. But what I also want to reassure people is that the 3 patients that we had in the unit at the time already had move-on plans in place, and in fact 2 of the patients have been discharged and another continues in our care in a different environment. The estates work, and there were numerous references within the report to the estates work, has already begun and is being progressed. And importantly, the update against all of the recommendations for areas of improvement identified within the report is due to go back to HIW next week. We're on track with being able to provide that update, and as Steve has indicated, we will be taking a much deeper and thorough look at all of the actions related to that specific report, but much more widely, because obviously the report made reference to potential systemic issues that we needed to assure ourselves. We have undertaken the corporate quality assurance team yesterday undertook 2 unannounced visits to our 2 remaining open units. And I'm pleased to report that the staff there, they found the staff to be caring, kind, compassionate, well trained. Whilst there were some training needs that were still requiring to be fulfilled, there are plans for those to actually be undertaken. And importantly, there was a clear schedule of activities in both units that were available and actively being pursued for patients there. So whilst I absolutely appreciate the specifics within the report will have caused significant concern and alarm to anybody who has relatives in any of our learning disability units, we have undertaken rapidly steps to make improvements. So as Steve has indicated, we will be taking it through a further more detailed review in due course.
Thanks, Mandy, and yes, we'd welcome that report coming, and we welcome also that it's a wider review that we need to seek assurance on. So many thanks. I'm going to open. Shall I open for questions for members on that particular issue, or anything? Have you finished your report?
I've finished. Yes, I'm done. So any questions?
Sorry. Any questions for Steve?
Maynard.
That's the question.
Maynard.
6-3.
Yeah, it's regards the principles of ARC, Steve. As you know, we get a regular report to my committee on the work going on there, and it's really good to see the progress being made there. In the principles, though, I feel that there should be some mention of timeliness of care and equity of care.
Yeah, I think good point, Maynard. I think it's sort of inherent in everything that we're doing, but it isn't explicit. You're right. We will take that back. I think I'll talk to Lee. I think my understanding is that we are both intending to put this into our IM2Ps, so we've got an opportunity to ensure that it is as clear as possible on those issues. And I would reassure you, timeliness and access are sort of top of our mind, particularly when we're thinking about regional services. But we'll make sure that's built in.
Thanks, Steve.
Thanks, Maynard. Andrew, would you like to come in?
Yeah, it was just to add just a little bit to the mental health and learning disability conversation that we were just having, and just to add that there's been good progress since the autumn on developing the Transforming Learning Disabilities strategy, and the reviewing and developing the new inpatient and outreach service models. The opportunity to bring something back, an update on that in towards March, will be really useful. I also just wanted to add on the wider point around transforming mental health. I've currently got Phil Chicken, as I've reported to the board, undertaking a review of the actions we've taken under transforming mental health so far, a lot of which happened during the pandemic and in response to the pandemic. I'm meeting with him and Liz Cowell, who's the Director of Mental Health, next Tuesday to get an update, and there's a workshop planned for the 15th of February, which was delayed due to COVID and the restrictions around bringing people together. But I'm expecting then to establish or re-establish Transforming Mental Health Programme Board to receive that report and to help coordinate within the service the response to any recommendations or actions or further developments that report identifies. So it was just to add that we'll be bringing that programme board mechanism back into play over the next few weeks as well.
Thank you, Andrew. It's good news. Judith.
Thank you, Chair. Just wanted to add one point, if I may, in relation to the HIW report. You will have seen there's reference to an element of compliance with the Mental Health Act. And so just to give the board information, that aspect of the report will be discussed at the Mental Health Legislation Committee. We have it on the agenda for our next meeting, which is at the beginning of March.
Many thanks, Judith. Ewan.
Thanks, Chair. Just a quick question, really, in terms of, Steve, you mentioned around strategic partnerships. I was just wondering, in terms of, I know the capital subcommittee is obviously looking at the detail, which is great, but in terms of some of the flagship projects, such as the Carmarthen Hub now, which was the former Debenhams building, as we know, and the procurement in terms of the purchase for that, I was just wondering if we could perhaps highlight that in a future meeting in terms of your report, obviously in terms of your liaison with Chief Executive Carmarthenshire, because there are concerns, I think, in terms of some of the voluntary sector organisations across the region, in terms of the timescales that it will take to repurpose that building. And I think, some of the comments have come back that it'll take as much time to repurpose it as it is to build it. So perhaps it's just in terms of some of the partnership elements that we can look at how we can perhaps fast track some of those elements with our kind of key strategic leaders and other partner organisations, so that our residents, clients and customers who will utilise that flagship building within our county town here in Carmarthenshire and for the rest of the region will benefit sooner rather than later.
Yeah, I think a good point. I think maybe the way to do that, Ewan, will be useful to put into the public domain a high-level report about the timescales, what we're trying to achieve there in that building. So I don't think we've done that in clear terms before, and then we can take the detail through the relevant committee. My understanding is there's quite a lot of building work to do in order to make the building more better light and accessibility and so on. But probably better we can bring that back with a bit more detail, and we can push. I think we would share your ambition to try and get this done faster than maybe it's in the plan, but we'll need to look at that carefully. But if we bring something back to board, give a high level overview about what the plan is, and then we'll take it through committee.
Thank you, Steve.
Thank you. If I could bring in Gareth, please.
Thank you, Chair. Yes, it's on mental health and LD in particular again. Will the report that will come back to board include the work being undertaken by your local authority partners in social care, particularly in the area of learning disabilities?
I think it can do, Gareth. I was particularly thinking around in relation to the report I mentioned, giving an update on the planning objective we have, 5G, which covered probably more the health service actions we were taking. I mean, some of that is inherently in partnership, particularly the transforming mental health and transforming LD part of this. But I'll talk to Andrew about how we might be able to create those links and give a bit of a wider overview across all of our partners.
Thank you, Steve. I wasn't particularly referring to the HIW report. It's the wider transformation journey the mental health LD are on. Thank you.
Yeah, so we'll do it in relation to that wider report. We'll see what we can build in from the point of view of what's happening in our partners.
Thank you.
Thanks, Gareth. Paul?
Thank you, Chair. Again, on the HI Health Inspector's report, obviously it's reassuring that the assurance that Mandy gave us was helpful about the work that's been undertaken. As part of the exercise which Steve outlined that we were going to undertake, and would it be possible, please, if we could have some explanation as to how come this situation arose and was not picked up by our internal governance and quality assurance mechanisms?
Yeah, absolutely, Paul. Mandy and I picked that up.
Thank you.
Mandy, did you want to come in on that?
It was only to offer assurance that absolutely we are currently working through the arrangements that we have in place, not only so on one hand about how we handle reports and inspections, but actually more importantly the work that Andrew and I are doing to review the operational governance arrangements, so that, as you say, we don't have any surprises. We shouldn't get surprises from an external inspectorate body. We should know these issues in advance. So that's something that Andrew and I are working on jointly.
And maybe if I could just add to that, so the intention, Mandy, I think it would be helpful to take that from quality and safety, not just the action plan in relation to the recommendations from HIW, but also that wider work that we want to do to ensure that these things are spotted by us more quickly.
Yes, absolutely. And as I say, we have got something going back to quality and safety, so we'll be able to have a more detailed conversation about the specific unit and the report findings, but actually the broader issues about how we're going about, as part of our quality management system, actually undertaking the element of it that is about assurance and quality control, etc. So that will all come together.
Super. Many thanks. Are there any other questions? And we've agreed, and we really welcome this, that we're going to have a detailed report on mental health and learning disability, if possible, including social care responsibilities, coming to the next board in March. Also, that high-level report on the repurposing of Debenhams, so that it's transparent and we've got the opportunity to question it, and then the detailed response to the HIW report, in particular the quality management system in our organisation going forward, and also we'll go to quality and safety committee. So subject to those, are the board's happy to agree all the recommendations at the end of the chief executive's report? Many thanks. Thank you, Steve. We're now going to go on to the report of the Audit Risk Assurance Committee, and Paul, that's you.
Thank you, Chair. Yes, it's the report from the meeting of the 14th of December. The report hopefully speaks for itself. You will see that at the end of the report there are, on top of page 4, there are a number of issues which we draw into the board's attention. None of them specifically require any action on the part of the board. It's really for information. And in relation to the matter of concern, that's an issue that ARAC will be following up as part of its monitoring of outstanding and recommendations from audit reports. And the reason for that was that the changes which have taken place in the specific directorate were relatively new, and we wanted to be assured that they were actually bedded into the directorate, and therefore we'll be looking at that at a fairly early stage. Happy to take any questions.
Thank you, Paul. Any questions on this report? No. Okay, thank you, Paul, and thank you for the work of the committee in keeping us safe. Thank you very much. And so the next item on the agenda is the Audit Wales annual report and Audit Wales structured assessment. So
can I just say, Chair, Anne Began, who is our performance auditor, who would have joined us today to present structured assessment, has got IT challenges at the moment.
Oh,
so that's Claire James is here and he's going to cover both the financial and the performance elements, Chair.
Okay, thank you, Claire, and welcome. I hope you're okay. Hope you're okay covering both at such short notice.
No problem at all. Thank you, Chair. So this report summarises our work for the year, most of which you've had the reports already, your audit committee or the board. And as you know, Our work is reporting and auditing on your financial statements for 2021, and also our duty to assess your arrangements to ensure economy and efficiency and effectiveness in your use of resources. I wanted to reflect again that our approach continues to be as flexible as it can be to work around the current pressures you are responding to on COVID. But obviously we aim and continue to aim to scrutinise as we're required to do, and also provide you insight where we can. So key issues for us for the audit of accounts was your statements were fairly and truthfully set out your financial position, which was great. We made a few recommendations to your team for improvements, but nothing hugely significant, and it's good to know there are no material weaknesses in your internal controls. We did need to qualify your regularity expenditure because you breached your expenditure limit for the year, which technically means it's unauthorised, but actually in terms of financial stewardship and the fairness of your accounts, all very positive. In terms of the performance audit work for the year, we of course focus on the use of your resources, and you'll see from the report that we increased our focus during the year to your response to COVID, and that was across NHS widely, and of course relating to you as well. We also ensured to maintain oversight of your governance arrangements as well. So Strategy Assessment 1 you've already had reported to you, which was your operational planning, and in phase 2 we looked at your corporate governance arrangement. So positive messages in that, and also positive messages about the innovative work the Health Board is doing and leading on. We do continue to flag the financial challenges, and the common thread throughout our reports in respect to the operational governance arrangements and the focus on that which needs to be improved. Big thanks really from us for the Health Board for continuing to work with us and support us through the year and taking a flexible approach to our work. But I'm very happy to take any questions from you on that report.
Many thanks, Claire. I'm going to. Sorry, what is the?
So I'll come in first. I know there's a few people who want to come in. I know Maynard's got a question, but I think without wishing to steal other people's thunder, it's just firstly to thank Audit Wales for the constructive approach to dealing with this, actually over the last 2 years in quite challenging circumstances. I think the working relationship is really positive, and of course for us as a board, these are really important sources of assurance and things to think about. There are of course always issues to note, and they're set out in the S-bar. But overall, I think I can see in these reports the kind of benefit of the work we've been doing over the last 2 years to take the learning that we've had from this awful pandemic to clarify what our strategic intent and what our planning intent is, strengthen our board oversight and assurance, and align our efforts more closely to quote the chair, making the boat go faster. So I was really pleased to read. I think it's a really fair resonates. The reflection resonates with where we are. Clearly, there's much more we need to focus on. We've still got big challenges ahead, not least on financial recovery. But it is good to see this here today.
Thanks, Steve. Maynard and then Winston.
Thank you, Chair. It's a question for us really. One of the findings in the annual report was about the need to improve the Health Board system to collect year-end annual leave balances. Now that was flagged as part of the review of the accounts, so we've known about it for best part of 6 months. And I'm just wondering, have we managed to take any action in that area yet?
Lisa?
Yeah, thank you for the question. Yes, we have. We now report and record absence on ESR, and at the People Committee we have a regular report about annual leave taken and what's outstanding. That highlights areas where there seems to be a high level of outstanding annual leave, and that's flagged with all of our managers. We are assessing the reports on Intrepid, which is where our medical annual leave is booked, and we're just checking a couple of directorates' data quality issues in there, so that will continue to improve. And then there were a few directorates, about 6, that weren't using ESR for leave reporting, and we are putting them onto ESR from the 1st of April. So we've done quite a lot of work on that one.
Great, thanks Lisa, good to hear.
Thank you. If I could bring in Winston, please.
Thank you, good morning. Thank you for quite a complimentary but fair report actually on Audit Wales. And as a relatively new IM, I joined in April and I chair the Sustainable Resources Committee, the Finance Committee. I thought what you've written really challenged with what I said, but my specific comment is during your report you refer quite a lot to the Health Board needing to maintain continues to maintain appropriate financial controls and is working hard to support longer term sustainability, which I presume that means financial sustainability, i.e. financial balance. And the Health Board has robust arrangements in place for monitoring and scrutinising the financial position. I just wondered, in your opinion, is there any more that we should be doing, could be doing, from an audit perspective or from a sort of controls perspective towards that aim? Because I think you acknowledge in your report that we're dealing with and managing a number of risks. So I'll be really willing to hear what your thoughts are on that.
Okay, well, I think there's two aspects really. Financial stewardship is sound, so taking care of the money you have and knowing where it goes and recording it well is absolutely sound. The difficulty, as ever with Hawddar, is the question around long-term financial sustainability and delivering services in a rural area for the demographics you have and all those wide issues. So I think, you know, as I said, it's part of the strategy, part of your long-term plan in terms of what the board is putting in place for that long-term financial sustainability. So in terms of knowing where your money is going, controlling it, you understand that, there are no issues with that at all. It's that longer-term piece really about the sustainability of the Health Board in the wider context of the demographics, the rurality and all of those issues.
Yeah, can I just follow up? So my question was, is there any more you think we ought to be doing, in your opinion, on that? I think I acknowledge your answer is really good, but I was going to say that's a hard question.
I know.
Actually, I guess there's always, I suppose what we're trying to do in our reports is point out some of the areas where we think you can improve.
Yeah.
And certainly we see that you have a very positive approach to taking forward those recommendations, which is actually half the battle really. So you know, a positive response. So again, I probably can't really add anything more if that's okay.
No, that's fine. Thank you. Thanks very much. Thank you, Chair.
Thank you. And I'm going to bring in Steve.
Yeah, I think it's just a really fascinating question, and I think Claire's view back to us that actually we understand we have good stewardship of the money is important, but of course our financial situation is more linked to how we're delivering services, which is a nice segue into the programme business case later, which in its entirety, that desire to move to a social model for health is the board's long-term financial sustainability plan, if you like. So I think we've got to make sure both those things link together. You've got to have really good financial controls, and that's great, we've got them. And then you've got to have a really good plan. And hopefully, by the end of this board meeting, we'll have a plan signed off that we can then work towards that aim. But it's a good question, Winston.
Yeah, thank you. Are there any other questions before I bring Hugh in? Okay, Hugh.
Diolch Cadeirydd, and thank you Claire and to the team from Audit Wales for your ongoing support and critical challenge as well. And in many ways, you know, we see the end product of the work that you've done in the audit committee and indeed today at the board. But there's a lot that happens outside of those forums, and it's those conversations and debates and discussions that we have with you outside those forums that actually I find incredibly beneficial to identify the opportunities for improvement, identify the ways in which we can change our approach. And I think, as just coming back to Winston's comment, I think as we develop our strategy and develop our approach, I know we'll be having an ongoing dialogue, an ongoing debate with Audit Wales in terms of models and the best way of delivering our services. And I think that will be a very valuable contribution to us as we think about how we implement our strategy. So thank you to you and the team, Claire, for all of your support over the last 2 years. Extraordinary circumstances, extraordinary challenges that we've had, but dealt with incredibly professionally. Thank you.
Thank you, Claire. And could you pass our thanks on to Anne as well? And it's really, you know, a very fair report, but it's also really encouraging for us and helps with our confidence that we are on the right journey. particularly in respect to the future plans and the programme business case that we will be considering later on the board. So diolch yn fawr for everything, and it's good to have a trusted and a respected critical friend. So thank you so much.
Thank you, Chair.
And so the board is happy to accept the recommendation at the end of the S-bar. Thank you very much. So the next item on the agenda is the report of the Quality, Safety and Experience Committee. Over to you, Anne.
Thank you, Chair. Good morning, all. The report is a thorough account of the committee's business and our current area of concerns. Just noting that since we met in early December, it's been an incredibly busy period for the Health Board, so no doubt our forthcoming meeting in about 10 days' time will be as busy as ever. But I'm happy to move straight to questions in the interest of time.
Many thanks, Anna. Any questions? Michael.
Thank you, Chair. Thanks, Anna. Really good report. I was just struck by the reference on page 4 to the Strategic Safeguarding Working Group. I'm just wondered if Mandy could tell us a little bit more about the storyline behind 22 incidences of non-compliance. Is that kind of is there more to that story beyond just non-compliance of processes?
Yes, thank you for that. Yes, absolutely. So the issue specifically links, I believe, increasingly to the capacity and the activity that's taking place, particularly in our accident and emergency departments. So the issue is that staff haven't always fully completed the MARF, the multi-agency referral form. And that has then could have led to delays in strategy meetings and progressing the referral onwards. What I can say is that where those issues have been identified, the corporate safeguarding team have worked with the staff concerned to make sure that the documents are completed, the referral form is completed, and that submissions are made. As well as that, recognising that some of this is down to sheer capacity and activity and the pressures that our frontline staff are facing. There's been some ongoing training and some further discussions are taking place to work out what other mechanisms we can put in place across our services to make sure that staff are able to complete the documentation in a very timely manner. I wouldn't want anybody to think that there are other issues linked in. It is purely about the completion of the referral forms in the first instance.
Thanks, Mandy, really helpful.
So, Mandy, could I just ask, does that mean then that there weren't any children that suffered harm? It was more a process issue, but the children did get referred?
So at this moment in time, we don't collect data or we haven't got any data that links back to harm. So there's nothing to suggest that there's been adverse consequence. However, that is something that I've asked the team to relook at to make sure that any delays haven't resulted in harm occurring. So it is a process issue at the moment as we understand it, but that doesn't mean to say we won't do some further digging just to make sure and satisfy ourselves that we haven't missed anything accordingly. There are active discussions through the local safeguarding groups, but also through the board as well, the regional safeguarding board. So we're open and honest about these issues, but we will make sure that there isn't anything we can track back to direct harm.
Thanks, Mandy, and that will be reported to Quality and Safety, the outcome. Thank you.
Absolutely, we'll do a bit more of a deep dive so that people do have actual assurance over what we're doing and how we're managing it.
Thank you very much. Winston.
Thank you, Chair, and thank you, Anna, for a really clear report as well. The area that I was interested in, some concern, some question, is on radiology services. So you indicated that the committee received a deep dive report on radiology, and I think like many services, it's experiencing huge demand and a big difference between demand and supply that it could do. So I was concerned to hear about the recruitment challenge of radiology, and my question was about what kind of future assurances will you be looking for in relation to radiology and how that might be better. It may not be a question for you, Anna, to be honest. It may be a question which Director of Workforce and LD might answer, or others, but I was just struck by the fact that at the moment there's obviously a significant risk there with that service struggling to deal with its demands.
Thanks, Winston. I will ask exec colleagues to be on standby to add some detail to this, but I can give you my sort of sense as the chair of the committee that the item that we took on radiology, while there were some difficult messages in there, I think we all took a great deal of confidence and assurance from our new head of service, who in a very short space of time seems to be entirely on top of the issues and the long-standing issues that there have been, and I think we all felt confidence that this was an area which would get some accelerated attention. But I'll defer to my exec colleagues to add detail to that. Thank you.
Bring in Lisa and then Andrew.
Thank you. If I just comment upon the recruitment position, I'm delighted to say that we've made 4 offers of appointment for locum radiographers. 2 are going through their final stages of clearance at the moment. We have another that will be joining us in February, and the 4th will join us in July. So that's a significant improvement on previous reports.
Great, thanks, Mandy. It's good to hear. Andrew.
To be fair, I think probably Lisa and Anna have done a very good job of covering what I would have said, I think. So probably not too much more for me to add, other than I think the fresh eyes that the new head of radiology brought to it certainly given everybody a bit of confidence and assurance that there's a potentially an alternative route through some of the problems that we've been experiencing for some time. So the update from Lisa was obviously very helpful, and we'll continue to look at other ways and other opportunities to remodel and redesign the workforce to address some of the challenges we've got, although as the report indicates there will still be some issues for the foreseeable future as we work through that plan.
Thank you, and I'm going to bring Steve in.
Just a more general comment, because one of the things I've done in Wales is imaging. As just to recognise, we had the Imaging Academy in Wales, which was started about 4 years ago. I think the first recruits will be coming out of the other trainees will be coming out at the other end of that qualified. This is for radiology largely, but it was in recognition of the fact that actually there is a national, UK, indeed probably a global shortage of radiologists. But I think Wales has taken a really positive step forward with that. It just, the pipeline and the lead time is significantly long, but we should start to see the benefits of that academy in 2022 as the trainees come out the other end.
Good to hear. Thank you, Steve. Thank you, Winston. Deb asks in the message bar about the increase of safeguarding cases. Is that similar in other HBs?
So if I may respond, I think there's safeguarding has seen a significant increase across the piece, adult, children, domestic violence, and certainly my understanding is that pattern is common across, in fact, the entirety of the UK. In particular, we've got some pressures in our system at the moment linked into capacity within some of our services. So services that are routinely dealing with safeguarding matters, such as, for example, health visiting services, as well as the corporate team and also local authority colleagues. We must remember this is a partnership approach and response, are extremely busy. So it's not unique to here. It is something that all organisations are having to find ways of responding to. And sadly, you know, the level of capacity that is required is not insignificant. So the work of the safeguarding board and ourselves within the health board has seen an increase, both from primary care all the way through to those services that are wrapped around supporting individuals in need.
Wonderful. Are there any other questions? No, thank you. And thank you very much for the report and for the work of the committee. Diolch. The next item on the agenda is the Women and Children's Phase 2 project and the Capital Governance Review update. Over to you, Lee.
Yes, thank you, Chair. So the board will be very familiar with the Women and Children's Phase 2 project, as you referenced it earlier, Chair, and some of the challenges that we've experienced to date with that. It is a large and complex project.
Sorry, we have an answer.
On an aging hospital site and during a pandemic, but in addition to that, we've had some contractor performance issues as well, which I know board are very familiar.
Lee, we've got some problems with your signal, I think. Or it could be us.
Sorry, Chair, I don't know what happened then. It just kicked me out temporarily. Hopefully you can hear me now.
Yes, we can.
Great. Okay. So I was just saying about the difficulties that we've had with obviously the work on an aging hospital site and during the course of a pandemic, plus some of the contractor performance issues that we've experienced. We, as you noted earlier, pleased to confirm that we have now completed section 2 of the project, and the service and patients are now benefiting from the new facilities, which is excellent news, and obviously the whole purpose of the project itself. The full project is due to complete in July 23, but the nature of the project does mean that there are still inherent risks with it, which board should be aware of. And obviously we'll be closely monitoring that and working with the contractors through the course of the next 12 months to deliver that. The paper does reflect then on the learning that we've had through the course of the project. So we've had 3 internal audits undertaken, and with 36 recommendations, 34 of those have been closed to date. We've also undertaken a mid-project lessons learned review during the summer of last year. And finally, the issues arising from the project also prompted a more general review of the Health Board's capital governance arrangements, which reported to ARAC in October, and we took a management response to the same committee in December. We'll be monitoring that through the Strategic Development and Operational Delivery Committee going forward. So a paper updating on the progress with the scheme itself, but also the lessons that we've learned through that, and I'm happy to receive any questions or comments on it.
Many thanks, Lee. Can I open it to members for questions?
I'm Professor Gammon, Chair.
Hey.
Sorry, Lee. So I'm Professor Gammon. Sorry, John just text me some questions if that's okay. Professor Gammon's asked Lee, using women's and children's services as an example, the cost and the timeline has deteriorated, as you've noted, and he just wanted assurance that the costs and timelines won't be extended further, because you've noted that through the papers that have been presented to the planning committee. And his second question, Lee, was more importantly for the board, could you provide assurance about the capability and capacity to manage future schemes within the PBC, using this as an example where the timescales have slipped slightly alongside the costs changing throughout the project. He did ask me to say that he does absolutely recognise the good work in completing the labour ward, and it's just more the assurance for future projects.
Yes, thank you. So I think it's important to be clear that the nature of the project does mean that we couldn't give absolute assurance there wouldn't be further delays and challenges, because not least because of the fact that we're still in a pandemic as well. But we have done our level best to ensure that doesn't occur again, and obviously we're closely working with the contractors and monitoring the situation. Important to just note that there have been significant time delays. The financial delays are less significant. Financial implications are less significant, actually. So the majority of the overspend was we were aware of at the start of the scheme, and then there have been costs relating to COVID, which are not impacting on us as a health board. At the moment, we've incurred 300,000 of extra cost, and potentially we're identifying a further 300,000, so that's 600,000 on a near £30 million scheme. So it's not a significant proportion from a financial point of view, but that doesn't detract from the fact that the project itself has been delayed. The second thing, in relation to the second question, I think when we're looking forward to the programme business case and all the different projects that are associated with that, it is clear that we're not going to be able to deliver that scale of change within the existing capacity and capability. And we've talked about that a number of times as board. So we're going to need to make a step change in that resource, and particularly if we deliver all the schemes concurrently, which we'll mention a bit later. So we will need to make that change. I guess the one point I would make though is if you look at the table summarising all the schemes historically, actually the track record is pretty good. This is an anomaly within that, but an important anomaly for us to learn from. But generally speaking, the Health Board has delivered schemes broadly on time and within budget. So we can take some confidence from that, that we can continue to do that going forward.
Was key to some of the delays on this development due to the condition of Glangwili Hospital and having to build on an old site which isn't fit for purpose anymore.
Yes, absolutely. So when you're talking about a hospital that's 50 years old, you naturally uncover things as you go through a project that causes problems to the contractor and to ourselves. That said, there were some issues that the contractor should have identified from day one, so it's not entirely due to that either. So there's there are a few lessons from that.
Many thanks. Any other questions? Got a question from the CHC chair, I think. Question from the CHC?
Yeah, thank you, Chair. As you know, Lee, we were heavily involved with this project at the beginning and designing, etc. Can you give us some assurance at the moment that these hold-ups have not changed the spec of the project, in particular things like the bereavement room, which CHC were very keen on having, and also when are you going to update the public accordingly on where we are with this? Thank you, Chair.
Okay, I'm not aware that there have been any changes to the spec, but it might be a better place for Andrew to respond to that as the exec lead for the project. You might know further detail.
If I could perhaps come in as well, Steve and I visited the bereavement room last week in the special care baby units, and for such a a sad use of a room, it's really lovely and has been designed with people who have lost their babies, so been a lot of public input into the design. Over to you, Andrew.
I think you've probably answered the question, Chair. I was going to say that as far as I know, there have been no deviations from their spec, and actually their staff and patient feedback I'm aware of so far through the phases that have opened and been commissioned has been really positive. So
thank you. I'm going to bring in Steve as well.
It's just, I know our Director of Communications, Ionawr, isn't able to talk today, but just on the second part of Winston's question around communications, we have put out on all our social media platforms a really lovely video showing where we are, the stage that we're at now, and the facilities that are there, and it's had some really lovely comments.
That's great. Yeah, it was very heartwarming to see, particularly when you contrast the way it was before, and the room for families. It's so dignified. There's a lovely artwork that one of the nurses has taken the lead on. Beautiful cupboard full of baby grows and baby clothes, and with a public of knitted things. It's absolutely lovely. Really proud of it, and it's just what we deserve in West Wales.
Did struggle to get the chair out of that room.
I know. So, do you want to ask any more?
No, that's fine. Thank you, Chair.
Thanks very much. Any other questions? Okay, are the boards taking assurance from this that the government's arrangements in place to manage the project to completion, that the work undertaken on the mid-project lessons learnt review and the capital governance review to maximise learning and embed the learning both in this project and in the wider UHB capital programme? Yeah, thank you. Thanks, Lee. It does give us assurance, this review, for us going forward. Diolch yn fawr. Okay, the next item on the agenda is the board assurance framework.
Thank you, Chair. So since previous board in November, there's been obviously the BAP's been updated. The committees have seen the progress reports on all of the planning objectives. And you'll see within the paper, I'm not going to go through them all, the paper details, those that are on track and those that are being delivered and those that are now behind target, but there are obviously valid reasons for that with the pressures that are ongoing in the services at the moment. I think the real positive you'll see in the BAF this time, which Hugh's team have been working on, is in relation to our outcome measures. So you've got the first results from our staff survey, which we've tried to incorporate, and as we go along, the outcome measures will become more and more integral to the BAF. So just to really overall, there's 4 POs completed, 32 on track, 2 ahead and 2 behind, which, as I said, is a slightly deteriorating position from the last time, but I think there are valid reasons for that, Chair, at the moment, so I wasn't going to say anything else.
Thanks, Joe. Michael would like to ask a question.
Thanks, Chair. I think probably Joe's just answered it, but I was struck by the fact on page 4 it says that 15 of the objectives are behind schedule. Presumably there's a handling strategy for those, even if they're not concluded by the end of this year. Presumably they just roll forward into next year's plan objectives.
Yeah, they do. Some of them may be merged or adjusted, Michael, but yeah, what we've agreed to do will be carried forward in some way, and that'll be really clear in the audit trail between the recovery plan for this year and the IMTP for next.
It might be helpful at the next board meeting if the BAF paper could just reflect what we did do with the ones that weren't quite concluded at the time.
Yeah, we can do that.
Yeah.
Thank you. Winston.
Yeah, thank you, Chair. Thank you, Joe and Steve, for a really informative report. I just want to draw the attention to, I think it's the last page of this report, which refers to Strategic Objective 6, Sustainable Use of Resources. There's a comment at the last bullet point says that in December 21, less than 4% of the Health Board third-party spend was with local UODAR suppliers. The really question is, how certain are we of that information, that is the case? But more the opportunity actually is, well, what might that look like if it was more like 10% of the Health Board third-party spend, and the impact that might have for local suppliers and the local community?
Thanks, Winston. Hugh.
Yeah, thank you, Winston. And this is an area I'm personally passionate about, seeing what we can do to increase our local spend. There are a couple of issues that have been driving, funny enough, a reduction in our local spend. One of which is, of course, if we go back a year, we'd spent a significant amount on field hospitals locally, which had increased our local spend in proportion to our total. The other set of challenges we've got is this year we've been outsourcing activity, and we haven't been able to secure that activity locally, and therefore we've had to go further afield. So that's had an impact on our ability to increase that rate. Just more proactively, I guess, in terms of our plans, we're now sharing. We've got a pipeline of procurement activity that is being shared on a monthly basis with our local authority partners, with Business Wales, and we're working with CLES, the Centre for Local Economic Studies, and Shared Services Procurement to see how we identify more opportunities for local supply chain spend. So a lot proactively going on in that space. It may take some time to see that shifting the dial significantly, given such a large amount of our spend by definition ends up being out of area. So our spend on drugs and medicines is all going to be out of area. So there's a limit to what we will be able to bring back in.
And Chair, could I just ask a follow-up? So thanks very much, Hugh. I just wondered about not so much the healthcare spending, but more things on sort of catering or buildings or facilities, whether there's any opportunities for that. And I do appreciate that we may already be locked into existing contracts, but it just seemed to me that that may be some quicker win areas actually for us.
Yeah, absolutely. Very briefly, we're working very actively with Cyhoeddus. Cyhoeddus Foods is a local supplier wholesaler here. And there are two elements to that: the breadth of the items that we can purchase from them that are locally sourced, and also the depth, actually, of the supply chain that's beneath that local procurement. So yeah, absolutely working on some of those quick wins. That's where we went. That's where we went to first.
Coffee on, thank you, Hugh. Brilliant.
I wonder if I could bring in Phil as well, because Phil is also leading a piece of work on food.
Thank you, Chair. So one of the objectives that I have is around optimising the food system for well-being, and we have tendered for support for this a feasibility study to look at the whole food system, to identify and map the system and identify the failures and disconnects within that system. We're expecting that piece of work to report towards the end of the spring, and we're expecting it to identify some actions for us, which I expect there'll be some clear ones around procurement, and I expect they'll emphasise and reinforce some of the work that Hugh is already engaged in. But also there'll be wider actions. I'd expect some actually to be around food literacy in our population and everything from that and in between. So look forward to the publication of that report, and we'll be sharing that widely. We're also hoping to engage very shortly with our partners, with the public service boards and the RPB about that piece of work, because of course this isn't something that we can just do on our own. Thank you.
Thanks, Phil. And I'm also going to bring in Steve.
Just to say, to link Phil's work back to the other parts of the health board, looking forward to all of that coming back through the transformation steering group, which I know hasn't met for some time for all sorts of reasons, but actually all of this work, and indeed other work around our social model for health and engagement, is going on in the background. So I'm expecting to see the transformation steering group meet a number of times this year, and of course the plan will then be from that discussion to bring back to board new potential planning objectives to sit alongside the ones that we'll be agreeing in the IMT.
Thank you. It's really assuring to hear the work that's going on, and it's so important that we use local suppliers and local food producers. I was up in Bronleys Hospital a few weeks ago, and the staff want their soft drinks and their water to come from Wales and not from England, and from local suppliers. Della's put in the chat bar that Swansea Bay have started work on their own farm producing some food. Can we find out more information about that, please? I think it's absolutely essential for well-being, and I'm sure it's going to get even more of a focus through our programme business case. So thanks for that question, Winston. Are there any other questions on this? Okay. The one request that we've agreed is that the next paper reflect those planning objectives which have not been concluded yet. Thank you for that, Jen.
Yeah, no, it will include the new planning objectives because the practical changes that probably align them to the work that these team are doing.
Lovely, thank you. So that board's happy to accept the recommendation. And if we now move on to the improving patient experience report, and that's Mandy.
Lovely, thank you. I'm not going to go through the report in detail. It's obviously quite a lengthy report, but there are a couple of points that I want to pull out to members' attention. Obviously, since the last report, we've seen an increase in the number of concerns and the contacts that have been made through to our contact centre, quite a sizable increase from 589 up to 819. That's resulted in 219 of those inquiries leading through to formal complaints managed under putting things right. However, on a positive, that does mean that the vast majority of concerns that come through are managed very, very quickly through an informal process. Key themes remain very similar in terms of waiting times, access to A&E has become a specific, staff attitudes and the environments in which we deliver care. And as we just heard from the last item, we do have some challenges across the whole of our estate, although clearly making some significant improvements. On a positive, the essence that we capture through the feedback from the various systems that we utilise, whilst we hear that patients are concerned about staff attitude, overwhelmingly the feedback about our staff is that they respond with kindness, compassion and professionalism. And I think that it's always good to balance and reflect upon both the positive and the things that we could do better. Communication and support for our patients is something clearly that we can do more on, and certainly in the story on page 2, which is a story of somebody who has experienced cancer treatment. There are a number of things that are highlighted through that story, which I just want to call out. because I think it does help us to think through how we actually influence and shape our clinical pathway development, and the impact of having to travel to appointments, sometimes in other organisations, as we know from our pathways. So whilst it's not suggesting that we shouldn't have those pathways, what it is telling us is that we need to think through how do we support people who need to travel distances to their appointments. And that's something particularly the Cancer Services team are thinking about constantly when they're reviewing what they're doing. What I would like to say, however, is for anybody who has listened to the story, the commentary made about infection prevention, control and cleanliness in the ward environment doesn't refer to a clinical environment in this organisation. So I just wanted to provide assurance that we were continuing to provide good practice in relation to cleanliness and infection prevention control management. In as much as Glyn Cloughlin Primary School has offered us thanks, I want to say thank you to them as well for sharing their wonderful drawings and expressing their thanks to us as an organisation and the staff for the work that they've been doing. Those things often give staff a significant lift. The other thing that I want to do is just reflect very briefly upon the fact that pages 20 to 23 of the report talk about all of the work that the Arts in Health facilitators have undertaken. And I think, like me, you have to sort of pinch yourself and think, gosh, that's the first 2 months. And obviously there would have been an even more undertaken had we not had the Omicron wave, which unfortunately called a halt to many of our Christmas period events that had been planned. Nevertheless, I think it is remarkable what's being achieved in such a relatively short period of time by 2 very passionate facilitators. I'm not going to say any more. Hopefully that's given some highlights to draw attention to, but I'm more than happy to take any questions.
Many thanks, Mandy. I'm going to bring in Judith and then Maynard.
Thank you, Chair. Mandy, first of all, if I may, I was also going to commend the work of the artists that, as you've just referred to. I thought it was absolutely amazing the work they've done, as you say, in such a short period of time, and I really look forward to seeing how that develops. It's a wonderful start. My main question actually refers to page 7, which is the family friends test. You've referenced the rollout to other services, which I really welcome, but I wondered if you could just give an idea of timescales for that to take place, particularly in relation to mental health.
Sorry, I'm operating on 2 screens. It's difficult to get the mouse quickly to move. So yes, the Civica system, which is the All Wales system, had some delays in it, but I'm advised that it should be by the end of March that will be rolled out across the organisation. And in fact, Louise O'Connor, who leads on the patient experience work, is engaged with the mental health team to look at how we better capture feedback from mental health and learning disability people who use our services, both inpatient and community. So that conversation actually has taken afresh this week.
So I'm trying to pin you down a little bit. Do you think there will be something appearing next board meeting or maybe the one after?
I would like to say the next board meeting. I had hoped to be able to bring more back to this board meeting, but obviously the delays in the system haven't helped us. But certainly if not next board meeting, I would absolutely hope that we're able to bring it back to the next meeting. But I'm going to push the team to try and get something back for the next board meeting. And just to note, which I didn't reference, the work that we've been doing to try and increase the number of paediatric feedback opportunities, and that has seen a significant increase as well. So I'm really pleased about that. But we will push on with both mental health, learning disabilities, and also the work that we're trying to undertake to support primary care in the feedback arrangements as well.
Thank you very much.
Thanks, Judith.
Just on that one point, if I may just jump in, Mandy, I think as we're bringing back a paper around mental health and LD to the next meeting on wider issues, even if we're not able to nail exactly some of the detail, it'd be helpful to include an update on the friends and family test in relation to that at that meeting, if that's okay. I'm trying to judge your face, like I'm going to kick me under the table virtually.
No, absolutely. We'll make sure that we include reference to that.
It seems like a good opportunity to look at all of. Yes.
Thank you. Maynard.
Thanks, Mandy, for the report. It's great to see the whole thing. It really brings home how things are affecting our patients, and that's what we're all here to do. Noticed in the paper now that SDEC is appearing, obviously a new service, and I was just wondering, when we introduce a new service like SDEC, do we do any additional monitoring in that area to try and make sure that we get it right first time?
So at the moment, because SDEC has come on board relatively quickly, and obviously the teams have had limited access of actually physically being able to get in there, we would want to do some enhanced monitoring and enhanced capture of feedback. I think, as you quite rightly say, we have managed to get in there and capture some feedback, most of which I'd have to say has been extremely positive to date. But we will continue to include that as an area within the routine feedback now as we go forward.
Thanks, Mandy. And more generally, when we do introduce a new service, we do that enhanced monitoring when it's first introduced.
We haven't routinely, but it is something that I've asked to make sure that we're getting rapid feedback, because actually, as I've said, all feedback, both positive and the areas where we can improve, help us influence how we're going to continue to roll out the service and respond. So it is an absolute key part of what we do. We probably just need to systematise it a little bit more so that we don't miss anything out.
Yeah, great. Thanks very much, Mandy. It's great.
Yeah, it's just on a more general issue, and I think it is very sobering to see the impact that the current pressures are having in terms of patient experience, and of course our staff are also experiencing some of that pressure. Some of the feedback we're getting relates to, I can't think of a better phrase than sort of customer care. I just wanted to sort of mention to board we had a really positive report from Lisa yesterday about the work she's been doing in relation to the planning objective for rolling out customer care sort of training. What we agreed yesterday is that we'll bring that fully back to board so that we can put it in the public domain, because actually I think it's gone a good deal further than just training people in customer care. In fact, it now links really strongly to our desire to have sort of gift of well-being for our staff. So I'd like to bring that back for a fuller discussion at a future board meeting.
Thanks, Steve. We'd welcome that. Are there any questions? I'm going to ask Lisa if she would mind giving us some feedback. Mandy, you thanked the children for the lovely drawings that they sent in. It was such a wonderful thing for staff to receive and patients. And I know Lisa did a special thank you to the children in relation to a George Cross. And I wonder if she'd share that with the board.
Okay, so this is linked with the fact, and I'm sure hopefully many members will have received a copy now, that the Workforce and OD team undertook a period of reflection around what COVID felt like for them, working as workforce and OD professionals, but also as people affected by COVID. Part of that also then included pictures from members of our community and staff family members, where, if you remember, in the very early days of COVID, we had rainbows everywhere, and there were reflections about how it lifted people and gave them the strength to continue to go into work. So we wanted to recognise all of the children that were included in our book. So I took it upon myself to give them a little gift. So that was age dependent, because we had 16-year-olds and 2-year-olds that were included. But also we wanted to do something that was a bit special. So we actually issued each of them a replica of the George Cross and said that courage comes in many forms, and that is also about how you support and help others. So they were very courageous in how they managed without having to go to school and meeting their friends and family, and that they joined the NHS Army and made a contribution that they didn't know they were making at the time. So we issued each of them with a George Cross.
Thank you, Lisa, and I think that just sums up the values of this organisation in a lovely story, and thank you for doing that. And I'm sure they were delighted, each having a George Cross, which the Queen gave all the NHS staff in recognition of what everyone has done during the pandemic. So thank you. Mandy, could you pass on our congratulations to the Arts Health team, the two ladies, and also to the patient experience team. During the pandemic, members of the board are restricted in where they can actually go and meet staff and patients. And similarly, we usually have a patient at a board, and having this report is such an important insight into staff, into patient experience and what we're doing about it, how we're responding to things that aren't going as well as they should do, and also hearing what is going really, really well, and being able to thank our staff for that. So could you pass that on to the team, please? And we've agreed that we will have the report on mental health will also incorporate some friends and family test responses, and we'll have a customer care report to the board so we can see what we're doing to support staff in their dealings and their relationships with patients, and also to help their well-being with those skills. So thank you. So the board's happy to accept the report, and a massive thank you for that initiative, Lisa, which is in the message bar. It's wonderful. Okay, so the next item on the agenda, and we will have a break after this, is the integrated medium-term plan, and that's over to you, Lee.
Yes, thank you, Chair. And firstly, can I just offer my apologies to board members because there was an error with the original appendix that was, or Annex 1 that was attached. So there's a second one there without the formatting problems we had with the first one. The paper just provides a fairly brief update as to where we are in relation to the IMTP plan, in particular the planning objectives and progress with the plans more generally. It does also provide board members with a link to the NHS Wales planning framework, which was issued on the 9th of November, and note that the submission date for the IMTP has subsequently been revised to the end of March. The board should also note that if, as a health board, we deem we'll not be able to submit an approvable IMTP and therefore and within that balanced financial plan, we will need to inform Welsh Government by the 28th of February about that. And that may, as is noted in the paper, affect our escalation status. Since the last board, the health board has received its financial allocation for the next financial year, and as noted in the paper, the current outlook for ourselves and the rest of NHS Wales is actually extremely challenging. So we're intending to discuss this further at the board seminar in February. The other point to note, which isn't in the paper because we've only received this information last week, is that the health board has also had its discretionary capital money reduced by nearly 1.8 million, so that will also have consequences as to what we're able to do next year from our own discretionary budget. So the paper asks the board to endorse the planning objectives as they've been developed up to this point. It should be noted, though, that in light of the financial allocation, we're going to need to review that and consider the affordability of each of these planning objectives as part of furthering the plan over the next few weeks. So at this point, I was just going to open up to any questions or comments in relation to that, Chair, if that's okay.
Thank you, Lee. Judith, if you'd like to come in.
Yes, thank you. Thank you, Lee, for the report and the update. The comments about discretionary capital is a little concerning, but I'm sure we'll see more on that. Yeah, I have a question, actually. It's relating to strategic objective 4, in particular the one around the evaluation of the funds of the transformation fund projects, which will be needed anyway as part of the new financial settlement for the RPB. And just to remind the board, they were approved through the RPB. That was the route to apply for those funds. But the planning objective doesn't really encompass the fact that the partners will need to be engaged in that review, which I'm just seeking assurance that whilst it's not in the wording, that is what will happen, and perhaps that could be expanded so that it's very clear to our partners and the public that that will be taking place. Thank you.
Shall I come in on that one, Chair?
Thank you.
Yes, thank you. And Judith, this is a revision on the original objective. And our first concerns, I think, as a health board, when we entered into the transformation funding system probably 5 years ago now, was that for our component part of it, there were concerns around any potential legacy costs for what was going to be an initial 2-year funding arrangement. And of course, that's been extended over 5 years. So we've put the necessary assurances into that process over this point in time. But you're absolutely right. This is a regional arrangement, and the funding comes through that regional arrangement and discussed with the integrated executive team on a regular basis. So certainly for the ability to, I guess, comply and achieve this objective, those arrangements need to be in place. And I've been liaising very carefully with the integrated executive team. The guidance from Welsh Government has only, as you know, come out in December, which is quite late for that transition to take place into the next year. And the new programme director, Calvin Barlow, is putting together a working group which will allow us to review in full all of the transformation funds that are currently, the plans that are currently in place, and also the integrated care funding arrangements. Those will all need to be evaluated as they move forward into the new system. Now, we know that overall, from a health board share, we've got near enough the same amount, but that doesn't mean that all plans will continue in the same way. So I've certainly taken those discussions through that integrated arrangement, and I've talked at length with our own executive team about my personal ability to control all of that, because, as you say, it's a regional arrangement. So I'd want to offer that assurance. I guess the reason it's worded in this way is because we're not necessarily able to hold the regional partnership board or integrated executive team to account through this objective, but certainly our expectation or the expectation of the health board is that we certainly play our part in not only reviewing those funds that we receive as a recipient, but also going forward into next year. We know that we will also be the host organisation for that fund. So again, there will be further levels of scrutiny on us from a different level as well. But I wanted to assure you that those arrangements were firmly in place. Over the last few weeks, we've discussed them weekly at our integrated executive meeting, and I know that there was a discussion at the last regional partnership board also.
Okay, thank you very much, Jill. It is covered off in the statutory partnership update later, but I suppose I'm just saying that, and Hugh has put a comment there, but I think the implications of the health board, this may need to go through our finance committee, sorry, sustainable resources committee, because the impact on the health board could be significant.
Yes, and I think you're absolutely right there, Judith. We'll have to put that level of scrutiny in through our own systems as we move forward into the new funding arrangements. But the other thing that I wouldn't want to lose sight of is that whilst the resource is important, what is really essential are the outcomes that we achieve from this. And I think what we really wanted to build into our work around this from an integrated exec team and board was that the work we're doing and the programmes that we put in place deliver the necessary outcomes that we want to see for our population in line with our strategy.
Thank you, Jill. Thank you.
Thanks, Jill. Thanks, Judith. I'm going to bring in John and then Michael.
Thank you, Chair. Apologies for my late arrival due to IT connection problems, so I do apologise for that. Chair, can I just note, Chair, that in terms of these revised and new planning objectives, that I think we should applaud the OD team and Lisa's team with regards to the ambition that's set out in the new and the revised elements that we see within this paper. And I certainly welcome that work. However, with that ambition, equally, it makes me a little bit nervous because it talks about things that for example, interprofessional education, it talks about multi-professional education plan, and that makes me a little bit nervous because that's not easy. That's incredibly challenging to set ourselves a plan around particularly interprofessional education. And equally, it talks about an escalation of our integrated apprenticeships. Again, many organisations have tried this and not been successful. I guess the board is looking for assurance that we're clear about what these interprofessional education plans look like and what does it entail and mean for us as a board. And secondly, with the escalation of commissioned student numbers, as well as integrated apprenticeships, that we've got an appropriate placement capacity plan and placements identified for these individuals within the organisation and with key partners. Thank you.
Thank you, John. Please.
Okay, thank you. And yes, they are ambitious, but actually I have discussed them at great length with the team, and they are things that we genuinely believe that we want to get behind. This year we've seen some progress with our planning objectives. Some of them are further developments on from that. There are some, as you say, where the delivery is outside of our gift. However, we are working very closely with HEIW around what we can do to influence certain aspects of it. The education one is the largest of the objectives, in my opinion, in terms of just how we operationally bring together now the education for the whole organisation, but also strategically, how do we influence the future as well, and how do we use research around what do we expect in the next 10 years linked with our organisational development. In terms of the placement plans and capacity plans, that is something that Mandy's team and my team are working on at the moment, and recognising that we need to move outside of some areas where we have placements now. So we are embarking on how we do that ward by ward, hospital by hospital, community by community, to fully understand how many people can we have on work experience, volunteering, apprenticeships, grow your own, student nurses, etc., etc. And there is a board meeting this afternoon, a regional board meeting, where one of the agenda items is around a joint apprenticeship programme. So I'm very confident that this year we will be advertising for a number of individuals to join an integrated apprenticeship programme, and work will continue at pace now around what the placements will look like and how we will present that apprenticeship to our board and also with our county council colleagues.
Thank you, Chair. And if I can ask, Chair, as a follow-on from that, are we confident that we've got a sustainable financial model to support this, particularly when elements of it will require commissioning from HEIW?
Some of that will still need to be worked through, but we are having promising conversations with HEIW at the moment about the plans that we have in place for next year. So we are talking about increasing capacity for apprentices and grow your own. And at the moment, all of the feedback that we're having is very positive. So it is something that we still need to work through, and it may be something that we need a further conversation about. But as we discover those things through our plans on a page, we'll be bringing them back to the executive team and to board.
Thank you, Chair.
Thanks, John, and thank you, Lisa. And there's lots of comments in the message bar. I won't go through what they've been incorporated in the minutes, but there's a lot of support there, recognition of the challenge, but the right direction. I'm going to bring in Michael now, unless, sorry, Hugh, did you want to come in on the same topic?
Chair, just in terms of the financial settlement, and I think there's a challenge for us in recognising the long-term workforce issues that we have. We do need to consider how we prioritise the investment we need in staff development as part of our internal strategy, but also to give assurance that the global settlement from Welsh Government does include a continuation of the uplift into HEIW, which has now seen its third, I think, sustained year of growth in allocation. So there is a recognition nationally around the need for a sustainable model of funding for training and developing our future workforce.
Thanks, Hugh. Michael.
Thanks, Chair. Judith and Jill's exchange on strategic objective 4 reminds us that we don't act in isolation. We're part of a wider system. So it would be helpful to get some assurance that for those planning objectives where we work in partnership with others collectively, that they are aware of our planning objectives, are aware of our ambitions, and are signed up to them.
Thanks, Michael.
I might come in on that, Michael, as always, an insightful comment that gets you to think. I think the first thing I would say is, absolutely, I agree. having planning objectives means that we can go into those discussions, which indeed we do, with real clarity about what we're trying to achieve. So I think the starting point is really clear. We have also got, I think, much clearer arrangements with our partners now. So Jill mentioned the integrated executive group and really using that, not just in response to the pandemic, but getting back into more business as usual to be able to drive some of these planning objectives. They know what we need to achieve here, but also we've got things like the regional recovery group with Swansea Bay, we've got the Mid Wales group with Powys and Betsy and partners up there. We know where to put these things into those partnership arenas so that we are clear with our partners about it. But I think it is a good point. I think when I started, we weren't clear about what we were trying to achieve at Call as an organisation, and our partners didn't know how to deal with that. I think we are crystal clear now, and it does put us in a strong position to have the right sort of discussions with them.
Yeah, thanks, Steve. I mean, the only risk really is that others' ambitions could be a drag on ours if they're not fully aware of where we're trying to get to and at what sort of pace, really.
Yeah, agreed. And I think we have at different levels throughout the organisation ways of being able to deal with that, right from the chair and I in our meetings with all of our partners across the and then right down through the organisation. So we have ways of being able to manage that. But yes, we do need to keep our partners with us, and indeed we need to stay with our partners.
Thanks, Steve.
Thanks, Michael. And that includes the third sector as well, doesn't it? But you know that they're aware of our planning objectives so that they know where to bid for commissioning. Winston.
Yeah, I just want to be brief, really. I just want to have a comment on sustainable resources and these planning objectives. So not all of our planning objectives will actually require more resource, actually, and some, if we take forward, might actually help us to try and square this really difficult situation. So I'm just minded just to think about some of the ones in relation to implementing digital, or preferred earlier about more resourcing of initiatives in the local economy, for example, and some of the exciting things that we're proposing to do around carbon sustainability, buildings, procurement and estate. So it may actually mean that we actually focus more in the future board seminar that we're going to have in February around those that we actually need to accelerate as opposed to decelerating others. So that's just a comment I wanted to make. And at this stage, it's really hard to know what it looks like until we know more about the settlement.
Thanks, Winston.
Coming at the end.
Okay, any more questions? Okay, I'm going to bring in Steve.
Yeah, thanks, Chair. And actually, sort of starting where Winston left off there, I think we do have a significant challenge, as Hugh said, around the funding settlement for next year, which we will need to work through with board, and we'll do that in seminar, and will have an impact on some of these. But I absolutely agree. A lot of these are either cost neutral or will be able to create financial benefits down the line. I think the other part of the equation that we need to square, and Lisa's leading on this, is actually ensuring we have the staff to do all of this. And in some ways, I think that will be as much, if not more, of a limiting factor for us than the financial position might. There were just a couple of things I wanted to pick up in generality. I mean, it does feel very ambitious, and it may well be as a result of the staffing and the financial issues that we're going to need to curtail that by the time we get to a final version to bring to board in March. But to pick up the kind of Professor Gammon's question around ambition, I think one of the things that I learned during the pandemic, it is quite difficult to know how to pitch ambition. We did so much more than I ever believed was possible through the pandemic for a range of reasons, some of which maybe won't continue to exist. But trying to set planning objectives that are ambitious enough to really push us, whilst accepting in some of them we may not get there in the time that we hoped, or in the way that we hoped, or indeed to the degree we hoped. Feels to me like the right thing to do, to be pushing on all fronts. We do have a piece of work sort of outstanding that the board secretary and I are thinking about how we learn as we go along, so that we can understand how better to balance the doability and the ambition. But I think it's right to be erring on the side of ambition, and if we can't do it, we'll come back to board, we'll describe why, and we'll think of another way of doing it. But I think that's something we've really learned through the pandemic. The other thing I just wanted to mention is I am meeting each of the executives between now and the end of February to go through all of their planning objectives one-to-one, because of course these will be the individual execs' objectives as well. just to ensure we're really clear about what needs to be achieved, how it can be achieved, and squaring that circle of money, people, and ambition. So that work will go on between now and finalising at the end of March. So.
Super, thanks, Steve. I think that's really important points that you've just made. So the board's happy to approve the planning objectives, and also I'd like to say thank you for the clarity, the discipline, and the ambition, and the flexibility. And one of the big, messages that came from staff during the pandemic, where if you allow us to do it, we're as good as Google, we're as good as Amazon, and we are, and we've proven that. And so it is enabling that to go forward. So thank you for that. So members, I'm going to give we're going to have a 10-minute break before we come back to discuss the programme business case. So that will take us to 11:21. Thank you.
Paul, the standard practice is to keep the camera off unless you're just speaking, just so you know, okay?
Right, so welcome back, members. I'd also like to welcome Paul Williams, who's joining us for the next item on the agenda, which is implementing the Healthier Mid and West Wales Strategy Programme business case. So over to you, Lee.
Thank you, Chair. Yes, I'm delighted today to bring to board our programme business case in support of our strategy, Healthier Mid and West Wales. I think all board members will be aware that this represents a critical milestone for us in our strategic journey, and what we're looking to do is get support from board and then subsequently Welsh Government through this programme business case to for the programme itself, and then to progress the next stage of the business case process. Before I just get into summarising some of the key aspects of the case, I would, as you say, Chair, would like to welcome Paul and formally record my thanks to Paul, the Programme Director, for the project, and his team for the commitment, professionalism, expertise they've shown and invested into producing the case that you see before you today. I won't get into the details of the programme business case itself, or even the presentation. It's obviously a lengthy document, so that information there is there for board members to digest and to go through. But what I will do, just in my opening comments, is just pull out some of the key points for us as a board. So, firstly, important to state that the programme business case itself stays very much true to the strategy agreed in 2018. The principles and the design assumptions have carried through into this programme business case, and the configuration of services that are described are consistent with that strategy. The case for change within the document sets out the challenges and opportunities which led us to that strategy in the first place. In particular, the limitations of our current service configuration, fragility of many services that we provide, our ageing buildings and estate, and the opportunities that exist for us to make greater use of technologies to address and decarbonise our activities as much as possible, and to provide services closer to home, which is a key principle within our strategy, as the board knows. Our experience through the pandemic has reinforced those principles and those learning points, and in many ways as we've accelerated some of that strategic journey through the course of the last 2 years. The PBC itself set out a number of alternative implementation plans, which board members will have noted. Within that, we've got the ambition to deliver the new and improved facilities at the earliest opportunity. So what we've set out is that we would deliver the new urgent and planned care hospital, the community hubs, and the repurposed Glangwili and Withybush hospitals concurrently. We would deliver those concurrently. Now that is the shortest route to delivering the strategy, but it does also carry some additional risks and will be more resource intensive. So important for board members to note that that will therefore be subject to discussion with Welsh Government about in relation to that delivery plan. The board should also be aware that there's a high level assessment within the SBAR and within the case itself on the affordability of the programme and alignment with our financial roadmap that was mentioned earlier as well. We know that new and larger facilities will inevitably bring some additional costs, but the consolidation of services will also offset against these. So there's a balance in between the two. So what we've done is made the high level assessment to the best of our ability with the information that we have at this point. But naturally, as we get into the next stage of business case planning, we will get into a level of service planning detail that will allow us to test that further. But projecting 10 years into the future does bring some challenges, understandably, but we've sought some external reassurance around our assumptions at this stage, which you might want to elaborate on later. The SBAR also provides a brief update on where we are with the land process and highlights the importance of our transport work. We know that's going to be important to our population when accessing services in the future, and of course the public engagement that we want to continue with through the next period of years as we look to develop these plans. And then the final point I would just like to make before we open up to questions and comment is that we have requested letters of support from partner organisations across the region, and a number of those have already come in, and we presented the PVC and to a number of groups including the CHC executives. We received a few comments through that process, which we will look to incorporate into the final submission before it goes to Welsh Government, hopefully next week, if board support. Thank you, Chair.
Many thanks, Lee, and many thanks, Paul, and to your whole team. I'm going to bring in Steve first and then open for questions.
Yeah, apologies, I normally come at the end, but I just felt today with this particular paper I wanted to come in first, and it's actually partly because I feel today is a really important milestone day for this organisation, and we've had a few of those along the way, but it is just really I'm really delighted to see this coming here today after all the work that's gone into it. I don't want to go back through all of the history, but the journey we've been on to reconnect our organisation, to invest in our staff and our leadership, to then reach out to our public to really understand what they felt about the way our service was provided. This was all back in 2016, 2017. And then the huge, and I think genuine, heartfelt, open-hearted consultation we did in 2018, following a really robust process of thinking of every way in which we could solve the problems and challenges that we have in West Wales, as well as building on our opportunities, has led us to the point where we think this is the clearest, most credible plan that we have to deliver for our staff and for the people of West Wales. I think for me, particularly given where we are after the last unprecedented 24 months, this is an offer of hope to our staff that we can do better. Some of them work in unacceptable accommodation and in conditions and circumstances which we wouldn't want. This offers hope that we can start to fix those things, not just in the short term, but actually for the long term. And I think it also offers hope to our population. I know there are some concerns about some elements of this, but being able to offer services that are there when you need them, locally embedded wherever possible. But if you do need that urgent or specialist care, that it's there, that it's well run, and you get quick access, I think is hugely important to the future. And of course, we have also learned a lot through the pandemic around things like the use of digital, the need for flexible spaces that have now been built in and reflected in this. As Lee said, this is, although this feels like many stages down the line for us, this is kind of the first stage now. It is a prospectus for the future, and there's a huge amount of work now to shift our focus from a sort of top-down view of what the solutions are to very much a bottom-up, rebuilding all of our pathways built on that social model for health ambition at its foundation, to look at everything we do and to build those business cases coming out of that. We did have a very positive informal meeting with Welsh Government yesterday. They got some challenges for us. They want to ask some really deep questions of it, and we are very open and welcome that, because this is a huge amount of money for West Wales. My personal view, it's West Wales' turn. This level of investment has not been seen before, but I think is long overdue. We wanted to be clear about our broad timelines, as Lee said, to try and get all of this done. There is always a risk in that, that's seen as a target or as something which we slip from. I think I would just want to put in the public domain today that there are many things that we need to work through, many unknowns at the moment. So we absolutely want to hold our feet in the fire to get these things done in the timescales that are set out. But that's not all in our control, and there will be things that we didn't foresee, given the scale of this. So it sets out our ambition to try and do that. But I think the final reflection we had back from Welsh Government informally yesterday really summed it up for me, which was they felt this was the clearest solution for some very long-term problems that West Wales has had, very long-term challenges, probably going back decades, and it has been thoroughly and competently thought through as a set of solutions. And I think that's where I would leave it with the board today.
Thanks. Thank you, Steve. It's really important to hear your words, having gone through this whole journey with former Chair Bernie, who I'd like to, commend for laying all these foundations to get to this point. So thank you, Steve. I'm going to open it to members. I'm going to ask Judith to come in, then Phil, and then Delith.
Thank you, Chair. And Steve, thank you for just what you said. And I think West Wales absolutely does deserve this level of investment, but then you'd expect me to say that, wouldn't you? But anything I think certainly I can do to promote that, I'll be very happy to. What I really want to say is a few things. First of all, thank you to Lee and to Paul and the team. I thought these documents were actually excellent. I know not everybody within the location agreed with the proposals, but they are very clearly set out. And I think, anyone who does read maybe the shorter version can see absolutely what we're about. I guess the one thing I wanted to say, because when I joined the Health Board in 2016, this was just being talked about, but I don't think I'll ever forget, both in my NHS career and certainly in career as an IM, the presentation the board received in 2018 from a very wide range group of our clinicians who really wholeheartedly presented the case for change and all that was behind that. And it was an incredibly moving presentation. Again, not everybody would have agreed with their outcome, but it really did show an amazing level of involvement, engagement of our staff. And I don't know how we do this, but I think the commitment and passion they showed at that time does need to somehow come through in what we send in to Welsh Government. Although staff have been through an incredibly difficult time with COVID, and I think I would hope that this does enable them to link back to see that that hasn't been forgotten and that we're on that journey. So if we can find a way of just expanding on that real commitment there was from our clinicians, which, as I say, certainly moved me and I know a number of others, that would be great. I really welcome the commitment to keep people engaged at all times. All of the sessions that I was involved in, people wanted to know what was happening locally, what was happening to their GP surgery, the local facilities, what would they look like, when could they use them? And I think that is something we need to make sure we tell them all, or we discuss with them all the way along, and not only focus on the exciting new hospital that is going to be coming, but those integrated centres, the improvement to community facilities is incredibly important to people. My final point, I used to live in a different part of Wales, I won't name names, And I know as a resident in that part of Wales, I knew nothing about what was happening with a new development in that area until about 2 weeks before it opened. So there are lessons to be learnt from elsewhere about people understanding absolutely what new services are going to look like. So I commend the approach. I just think this is a marvellous stage to have reached. I won't be here when it's all finished, although I will be living here, so I will be using the services. So thank you to all the team, but let's not forget all the passion that was into making those changes. Thank you.
And thank you, Judith. And it's really, really important, as you said, to remember the journey that West Wales, the population of West Wales, the clinicians and this board has been on to get to this point. So thank you for that, and all the points that you made in relation to engagement and public needing to know and being part of the decision-making process for their own localities. Phil, I'm going to bring you in, please.
Thank you, Chair, and absolutely delighted that we've reached this stage. Well done to the team. And I do think when we move into the next stage, as Steve says, there's that opportunity to have the same approach that we had in the building of the strategy, working with our clinicians and interacting with our communities and engaging with them. I think that's a really exciting prospect as we hopefully move into the next stage. I was going to say that, look, the timelines are challenging, as Steve said, and we're really pushing ourselves on the timelines. And the reason we're pushing ourselves on the timelines is that the really strong drivers for change that were there since the generation of the strategy and before are still there, and they're perhaps even stronger. And I think when you speak to people who were really pushing for this, and there are so many of them, they will say that the timelines we've set out, they will say are too long, actually. But understandably, it's understandable why the timelines are the timelines that we've got. So I think we just need to remember that the drivers are there, and we'll push ourselves as much as we can on that. There's one small point I wanted to make, which is about which I've discussed with Lee prior to board, but wanted to say publicly, was that I think we just need to probably profile our ambitions around research, innovation and health education more strongly in the document, because it was one of the drivers behind the change that we proposed, and our facilities and infrastructure make it really difficult for us to provide really top class health education, research and innovation, and those things do impact on quality of care, and they do impact on our ability to recruit and retain the best staff. So I think we should be really ambitious about those areas as well in this PBC. But thank you very much.
Thank you, Phil. Thank you for your comments, and I'm sure that will be incorporated before the final document gets submitted. Thank you, Delith.
Thank you, Chair, and thank you, Lee and Phil. Interestingly, you talk about public engagement. Can you assure me that the population of the future will be engaged and involved in forward planning what they perceive should be the services in West Wales? And I echo Steve's comment about West Wales needs this funding. We're often forgotten with a forgotten end of the M4. So I really welcome this investment. But Lee, can you assure me that the population of the future will be fully involved? Diolch.
Yes, thank you, Dal. So I think there's probably two aspects to that, isn't there? So this is a plan for at least the next 30 to 50 years, essentially. So the group that has the biggest stake in that are, as you say, the young people of today. So I completely agree with the sentiment within your question that we need to engage them in the design of that and incorporate their wishes and desires and ambitions as part of that. So as we move into the next stage, on the assumption that the PBC is endorsed by Welsh Government, we'll certainly be looking to engage with all parts of our communities and including with that the young people. And the other challenge that Steve has put to us as a programme when we're looking at this is to also consider how we listen to the voices of generations that haven't been born yet, which is a practically difficult thing to do, but conceptually you can understand why that is a very important thing for us to consider. So we can do that through things like considering our impact on the environment and the planet and green health, etc. But there are probably some other aspects we need to consider as part of that as well. So massive opportunities within the programme business case, as we've said, for the population of Mid and West Wales, and certainly in truth we're doing this for generations beyond us, aren't we? So I think the key is to hear their voice in the design of that.
Thank you. Thanks, Dylan. Thanks, Lee. I'm going to bring in Gareth now.
Thank you very much, Chair. And first of all, can I reiterate everyone's thanks. This is an immense piece of work, and it's only the first step within the process. Absolutely very, very impressive. Can I mainly though thank you for being so honest and so open with our population. You know, it clearly proves that things can't carry on as they are. The current model is totally unsustainable, and the clinical case for change is overwhelmingly proved, in my opinion, as is the need to address the archaic estate, as is the case of concentrating now our scarce clinical resources and expertise, and they will remain increasingly scarce, and actually concentrate that in a new urgent and planned care, state-of-the-art new hospital. So thank you for the honesty. And I think the facts as they are today, I think the population itself will maybe surprised, but they will be at least reassured that we're open and honest with the actual problems that we actually face. Up until now, all the modelling, for instance, has been quite understandably based on hospital activity. You know, I go now to the main document, Health in Mid and West Wales. There are design assumptions in there, and we've spoken a lot about ambition today. I prefer to call those design assumptions ambitious targets. For instance, the figures about around outpatient discharges, bed discharges, the reduction of levels of people attending A&E to go into minor injuries units, the daycare communities shift where 50% of day cases will take place in a community setting. So really, it's only touched upon here, but I think what will really add to this at later stages is when the public become aware of the immense investment that will be required in community services to meet those very ambitious targets to make the model work. So once again, thank you for this, and I really look forward actually to the feedback that we will get from government with regards to the future sense of direction. And thank you as well for the timelines. I think it's important to have timelines. Again, ambitious, and 2029 seems a long way away, but with the amount of work projected here, given a fair wind, it'll pass in no time. So diolch yn fawr I chi gyd, and you have my full support for the proposals as they're submitted. Diolch yn fawr I chi.
Diolch yn fawr, Gareth. Thank you. Ewan.
Diolch, Chair. Thank you, Chair. And again, just to echo colleagues in terms of, a big thanks to Lee, Paul and the team for, the considerable work which has been undertaken. And to echo Steve's points in terms of this is a huge opportunity for us as a region. And I think aside from the obvious kind of benefits in terms of for our patients and our staff, in terms of the repurpose of, existing kind of estate, as well as obviously the new building in terms of the new hospital. Really welcome to see in terms of the presentation, the kind of signposting now to what it means for our wider region in terms of particularly our economy, environment and education. And I think if we're kind of genuinely going to get the public on board with us to take them on that journey with us in terms of this considerable investment in West Wales, I think those kind of three markers will be particularly relevant for our wider population in terms of what it does for our economy here in West Wales, and then the impact on our supply chains in terms of the environment and obviously in terms of the build itself and how it's going to conform to, you know, the latest standards and promote in terms of a more sustainable capital infrastructure, but also then in terms of education. And as you know, you yourself have said, Lee, it's about looking at future generations. And I know we've already talked within various subgroups and meetings about the liaison with both not only just schools, but also in terms of our further education and higher education partners, because they will be critical in terms of giving us that labour market as we go through to provide that sustainable economic model for West Wales in terms of our wider communities, because you know, our communities need sustainable, good, well-paid jobs. We need those skills to be retained within our communities, and the impact that has then in terms of obviously our carbon deficit, if people are not having to travel as far for work and for skills, it has that huge positive impact for the region. And again, very much welcome the proposal, the work which has been done, and you know, along obviously with colleagues, very much supportive of taking this journey forward and making sure that all our relevant partners, particularly in the third and voluntary sector, at the forefront of our communities, work alongside us to actually make sure we deliver this for West Wales. So diolch yn fawr iawn, thank you.
Diolch, Johan. I would like to bring Lisa in because I think it is such an all-encompassing document for the whole programme that sometimes we might miss some of the detail. And building on the point about the economy and jobs, I'd like the public to hear what we're trying to do to ensure that we have local jobs for local people to build all these local buildings, including the big hospital. So over to you, Lisa.
Okay, so there's two areas that we're focusing on really. One is around the workforce for the future that we will need for all of our facilities, whether they be hospital-based or community-based. And whilst we haven't got the detail of a workforce plan in this document, we do have some high-level indications in there, and we also look at future labour markets. As Ewan pointed out earlier, we are in conversations with our colleges and universities, and we also look at what we predict will happen with our current workforce. In addition to that, we've also started to have some conversations with estates and engineering, and linking in again with colleges and an organisation that supports our local businesses to employ apprentices in the trades. And the conversations that we're having, and we're trying to set up a facilitated meeting with some of those organisations, is how can we support them and colleges to actually provide supported apprenticeship programmes, so that as we are moving into development of new facilities or upgrading of existing ones, that actually our local businesses would also be able to take part in what will be their future services. The second part to that then is also, is there an opportunity as buildings and developments are made, that we look at a workforce that actually isn't our employed workforce. So it's how we work in partnership. We could provide coaching, supporting, we can provide certain types of experience, but the plan would be that they remain locally employed by our local businesses, and therefore keeping resources within our local communities.
Thanks, Lisa. It's really important. What we've wanted from the beginning is to home knit this development rather than have people fly in with glass and steel erections, you know. I'm going to bring in Jill and then Hugh.
Thank you very much, Chair. And again, thanks to Lee and Paul and the team in terms of the documents. And I was part of obviously the sort of consultation with the public and the passion that was shown as we were talking to them. And I think it's really important to remember that when we formally went out to consultation, we were consulting on the hospital. But actually what we got when we talked to our communities was that passion, that concern and that enthusiasm for, as colleagues have said, their local services, and real concern around what the community and primary care system would look like in the consequence of these changes. And we also went through some quite significant general practice changes at that time and had hundreds of people turning up to those discussions. So again, shows the real importance of that relationship with local services to our communities. So what I wanted to do was perhaps just draw some of the opportunities that we've got together coming forward. We know that we've got a population needs assessment that's currently being undertaken by our Regional Partnership Board. And we know also, as part of our objectives and some of the national strategic work around primary care, that we are looking at developing within our own system integrated localities, and within that accelerating our cluster development. And part of that will be the development of pan-cluster groups, which will bring together our partners, our local citizens, and many forms of resource and planning that we've got within those pan-cluster groups to consider the opportunities for that local area and how it meets the population needs assessment issues that we're seeing. And we also know that over COVID, people have had to access services in different ways. So I think there's a lot of things that we can both capture from our experience over the last 2 years, but also the opportunity to really connect with our communities through those different forums that will ensure that as we develop the alternative support in terms of this within our community and what our community services look like, then we've got that opportunity to test that, I think, and work that through within our plan cluster groups as an opportunity.
Many thanks, Jill, and many thanks for reinforcing the importance and the actual massive focus in the programme business case of providing services closer to home. And it's a wellness plan, it's not a sickness plan. So thank you. Hugh.
Yes, thank you. Clearly, this is a very significant capital investment in West Wales with significant implications in the way in which we'll be providing services in the future and therefore the finances. And I wanted you to just recognise the duty we have as a board to make sure that this is the best use of taxpayers' funding. So just to give the board assurance, my team have gone through the finances, we've scrutinised the proposal, and I sought external assurance via PwC, who I'm pleased to say concurred with our internal assessment. So that gives me confidence in recommending this for board approval at this stage, recognising, of course, that further work is needed as we work through the detail of the underlying cases and the opportunities that will give us to provide services differently and address some of the revenue challenges that we will have over the period. But I also wanted to recognise that very important point that Iwan made, that this is an investment in health in West Wales, but it's a significant investment in the economy in West Wales. And the opportunity that gives us, I think, as an economic agent, the opportunity that gives us to transform the way in which we extend out from the normal range of activities that we would be thinking about to look differently at folk coming through the education sector and how they get employed within the supply chain. I think that really is a transformational opportunity and one that we need to grasp as part of the broad plan. So a very exciting opportunity, not just for health, but also for the economy.
Many thanks, Hugh. I'm sure everyone concurs with that and how exciting it is. Any other questions or any comments from members? Okay. I'll just summarise then, if I may. This is a once-in-a-generation opportunity for West Wales. It's absolutely transformational. And as the Chief Executive says, it gives us hope. We've all suffered 2 years of this pandemic. People in our communities, our staff, and we've also had many, many years of an unfit estate in West Wales. And I saw that with fresh eyes when I came here as chair 2.5 years ago. Our time has come in West Wales, and we want to make promises to the people of West Wales. This is a high-level business case, and we promise that we will continue to engage and to listen and to co-design with our clinicians, our staff, our population on all the details. What we are doing today is approving the high-level business case. We also promise that we will communicate the plans. It's very difficult to read a 184-page document. It's actually a very uplifting document, but we promise to communicate it in really accessible ways for all our population and for all our staff, so that people can see what our promises are. And that will be right along the process. We will incorporate more on the economy and the supply chain and jobs, although it is in there. Maybe we need to beef it up, but we will incorporate more on the research, training and education as raised by Professor Gammon and Dr. Clare. And I'd just like to take this opportunity to thank everyone, the former chair, our chief executive, Lee, who was our new executive director of planning, Paul and your team, and all the executive team, all the clinicians and everyone in the history to get us here. And every single person who's played a part for us to get to this point. If we are signing this off today, subject to enhancing it with some of the really valuable comments, but it's a milestone in the history of health and the economy in West Wales, and we'll go forward and we'll do the best we can to get the investment that we deserve here and that we need here. So thank you, everybody. So go on to the next item of the agenda. Okay, the next item on the agenda is the, in fact, I can't even find it. What is it?
Organ donation.
Oh, organ donation. Sorry, organ donation report.
Sorry, Chair, just to be ultra clear for the minute, I know we've said this, but we are 100% approving the business case. Yeah.
Right, if anybody doesn't approve, please show your hands. We are 100%
Thank you,
subject to some of the enhancements. We are approving with pride this business case.
Thank you, Chair.
Thank you. Now we're going on to the organ donation report.
Thank you, Chair. Just a couple of comments to introduce it, if I may, but I think it's fairly self-explanatory, covering paper. So just to clarify, this provides an overview of Health Board performance against the priorities we set ourselves for organ donation through 2020 and 2021. You'll see from the report that we've generally made good progress or maintained performance against those priorities. The couple where we've had a little more difficulty have been largely due to around the impact of COVID on our ability to either free up intensive care teams to participate and lead some of the training we required, or our planned promotional community events that we had to defer because of sort of COVID restrictions and guidelines. It's probably worth noting that we're a very good contributor to the All Wales picture and organ donation, and we've certainly got a very active support network in the area for the organ donation work. And I just wanted to finish by recording my thanks to especially Ria John, the specialist nurse for organ donation, who's prepared the report and the paper for board today, but also all our colleagues for all of the important work they do in this area for us. Thank you.
Thank you very much, Andrew. And if I could bring in the chair, the Organ Donation Committee, Judith.
Thank you very much, Chair. And it's actually a great pleasure to chair this committee, which was a totally new area for myself. I just support everything Andrew said. If I may just add that we have an excellent specialist nurse in Ria John. She is going to be moving on to a new challenge still within the Health Board, so we will be recruiting for a replacement, but I don't think we'd have kept this going so well, particularly during COVID, without her incredible hard work. So I would like the board to particularly note our thanks to her for everything she has done. Thank you.
Thanks, Judith, and on behalf of the board, we do thank Ria. Are there any questions on the report? No, thank you very much, and thank you for all the work you're doing and the contribution you're making to saving lives. Thank you, Diolch. So the next item on the agenda is the delivering our recovery plan, the operational update and progress reports, and that's over to you, Steve.
Thank you, Chair. So going back to the here and now and the current situation we find ourselves in, this report gives an update on the position 2 weeks ago. When I was reviewing it yesterday, I had to remind myself that there have been some moments through this pandemic when things have felt like they've moved really quickly. I have to say probably the last month or so has moved extraordinarily quickly. The dynamic situation we found ourselves in has been, I think, unprecedented, even in these unprecedented times. So 2 months ago, we didn't even know about Omicron At the time I wrote the report, although we didn't know it at the time, we were approaching our peak for infections, and you'll see the numbers in the report were shockingly high. We used to have a threshold of 50 per 100,000 to start to get concerned about rates. We got to almost 2,000. So these levels and the positivity rate far above anything that we'd seen previously, and I think really demonstrated the difference that this particular variant was having. Our hospitalisation rates peaked soon after these numbers, so we peaked at around about a similar level to what we saw in October, around 150 to 160, and that included recovering patients, suspected patients at the time, and those being actively treated on intensive care. That's probably about half the rate, however, that we saw last winter, and I think that is in recognition of the fact that whilst infection rates were significantly higher, the protective effect of the vaccines and the booster programme was really being felt in the hospital system. I'm glad to say, in line with the modelling, and there was a huge amount of uncertainty about Omicron and how it was going to work, but the modelling did suggest that whilst the peak would come at us very quickly, that would be matched by an equally rapid decline in infections in our communities. So I was checking the rates this morning to compare to what's in my paper. Our rate per 100,000 is now at a little under 460 per 100,000, and our positivity is down to 31%. This is similar in infection rate terms to the levels we were seeing before Omicron hit, and broadly look like on current indications that they are stabilising in that 400 to 500 level that we've seen through the whole of the winter, indeed since September. Our hospitalisations have also reduced to somewhere between, there were 112 on Monday, but it's around 110 to 120. But actually, for the first time this week, I believe it was on Monday, we were able to report nobody in ICU requiring support for COVID, and that's the first time we've been able to say that since August of 2021. Staff sickness remains a concern. I think it has reduced slightly. The work that the Lisa and the workforce team have done to collect data now 4 times a day across the organisation, I think has given the tactical group some really good information upon which to work. The latest number I have is that we are at about 8.9%. That's still considerably higher than we would have in a normal winter. We can remember what those look like, but it is down from the peak. However, at the time that I wrote the report, and given what we were seeing coming through in the infection rates, there were a set of decisions that we needed to make at that point to ensure that we were ready for the hospitalisation that may result from this wave. So we took a number of decisions really based on our biggest concern about the impact this was going to have on our staffing levels. We know as we went into the pandemic, we had challenges around staffing and our ability to recruit, but we were concerned about that rate becoming extremely high, with people having to self-isolate either because of COVID infection themselves or because of being household contacts. So we made a number of decisions through tactical to use the existing choices framework that's been in place from Welsh Government for some time to stand down some services in order to allow us to have a few days to plan for redeployment. And you'll see in my report the decisions that we made in relation to that. And so I'm really pleased to say we always hoped that these measures would be short-lived, given what the modelling was saying at the time, and I think that's probably been borne out. I'll ask Andrew to give the very latest update on where we are with operations, with planned care, and the undoing of some of the urgent actions that we've taken when I finish with your permission, Chair. And finally, just to wrap up my reports, there are a set of gold command decisions there which are included for ratification, some plus some selected highlights from our recovery plan. And as we mentioned earlier, we'll bring back the mental health LD, planning objective, and the gift of wellbeing customer care to the next meeting. So we've got a bit of a deep dive on a few ones that we haven't looked at sometimes. So with your permission, I'll just hand over to Andrew just to give the latest position.
Many thanks. Andrew.
Thanks, Steve, and thank you, Chair. So as you outlined, Steve, we in response to some of the forecast pressures we were seeing and some of the increased staff absence there was in the system as a result of the increased community incidents and increasing levels of staff testing positive for COVID, but also having to isolate. We took a decision around 3 weeks ago to stand down some of our elective services to enable us to redeploy staff to inpatient and community service areas to manage some of the demands we were seeing and some of the gaps in staffing cover that we had. I'm pleased to say that as of last week, we took the decision based on the changing picture that we had seen and the improving sickness absence position, that we could reinstate all of our outpatient clinics as of this week. So we hadn't actually cancelled those, so they ran as normal this week, and all of the patients that were deferred from the previous 10 days to 2 weeks will be rebooked over there. But I think by the 7th or 8th of February, we had as a target date for getting all those back in. I think there were somewhere around 2,500 patients affected by those changes to outpatients, which I obviously apologise, but hope people understand the urgent need for us to take that action to protect some of the sickest patients in our community at that point, who are presenting at the front door where we weren't able to provide some of the cover we needed. The endoscopy service was particularly challenged at that point, but the staffing positions improved significantly, and we're back operating across all 4 sites and providing elective procedures and rebooking anybody that was affected back in, and I think most of those have now happened. And from a surgical perspective, we are in the process of re-establishing the surgical pathway in Bwrdd for cancer patients, which should be done by the end of, should be up and running next week, by the end of next week again. And we're now working and very focused on how we reinstate some of the other services we've had to stand down over the previous couple of months as a result of the pressures we've seen from COVID, in particular, a real focused effort to try and re-establish our orthopaedic inpatient operating capacity by the end of February in Prince Philip, and at the same time, to coincide with some capital works that will complete in Withybush, we anticipate we'll reopen Ward 9 for surgical activity, ring-fence surgical activity in Withybush by the end of February as well. So that will certainly make a difference in terms of our elective throughput and capacity across the health board. The only other point I just wanted to flag was it was indeed a milestone on Monday, having no patients in ITU for the first time since August with COVID. I suppose I do just have to caveat that with the nature of the virus and the disease does mean that we will have people who come through, I suspect, with the need for ITU care in the future. And indeed, we had somebody admitted in the last 48 hours, but it was a significant indicator for us on Monday that the overall position across the community and how that was improving. But I just don't want the board to think that we now won't have any ITU patients with COVID. That was all, just in case they see on future reports there are patients in ITU with COVID. I think the other thing to say is we are seeing far lower numbers through this wave, requiring some of the high flow oxygen on our specialist respiratory wards as well. So there are promising signs there, certainly for vaccinated patients, as the impact the vaccine is having on any illness.
Thank you, Andrew. And the board would also like to apologise for those patients who have had their procedures postponed. It's very worrying. And what you've just described then, the detail of how we are restarting services, post this, well, we're still in the wave, but it's decreased. How are we communicating that to the public so that they're aware what we are actually starting again and when we're starting?
Yeah,
I mean, rather than specifically.
No, we can follow up. I can follow up a conversation on how we maybe have a more targeted approach to communicating that. We wouldn't necessarily, as part of our escalation process, make public announcements about services restarting necessarily, but we can, given the significant impact we've seen over the last few weeks and months, I think there's something in how we make sure that's very clear and visible, and hopefully give confidence that we are starting to get back on track with some of our more routine elective activity as well.
I think so as well, Andrew, because we did inform the public when we were postponing. I think it's important that, you know, they see that we're doing everything we can to recover and get their services back.
Yeah, and I think we are at a bit of a difficult moment. There is always a bit of a balancing act with communications, that if things did take a turn for the worse again, which, yes, you know, with schools remixing and so on, we would have given some concerns that we're not giving, yes, conflicting messages. But just saying in the more general sense of the recovery plan going into next year, the Director of Communications, Alwena, and I had a discussion this week about how we're going to continue to communicate the picture to the, yes, public in a similar way, but actually it's more complex, as we did with the vaccine rollout and the numbers of vaccines that we were giving. Great. So there's going to be a plan worked around that, which I think will probably be thematic. Yeah. So if you're waiting for your hip replacement, this is our plan, this is where we're going, this is what you might expect, as a general set of messages, yes, as well as Andrew said, individual patient contact with those who are affected. Yeah.
Thank you. It's really important. And John also says that. Could I bring in, I think it was Alison wanted to come in on infections.
Yes, thank you, Chair. I just wanted to provide a little bit of clarity around the current prevalence rates, because the figures that are reported on a daily basis have only ever included, and do still only include, the numbers of positive cases that are identified by the PCR laboratory tests. And around 3 weeks ago, Welsh Government made a change in policy that if anybody has a positive result on a lateral flow device test, that they no longer need to follow that up with a PCR. So what we've seen subsequently is quite a large drop in the demand for testing. But we've also seen, I think, a far more rapid drop in the reported prevalence than we would expect. So I just wanted to balance those figures, which Steve has correctly reported, that we know that the prevalence per 100,000 of our population, currently you can double those figures. If we added in the positivity rate from our local intelligence, from LFD reported positive results, the rates are actually quite a lot higher. But having said that, there is still confidence that the rates are lower than they were around the sort of pre-Christmas period, when they were very, very high. So I just wanted to make sure that board members were aware of that. It's definitely going in the direction that we want to see it in, although there have been a few increases in the last couple of days, but very minor. But the reports are missing a significant number of positive tests. So I just wanted to just really provide a bit of clarity about that.
Thanks, Alison, which is why the numbers admitted to hospital is more of a definite or a more reliable piece of data. Yeah, okay, thank you. Are there any other comments or questions? No, okay, the board's happy to ratify the Girl Command decisions set out above, and also note the annual recovery plan. And thank you very much to everyone for doing everything that they can to help us to recover. So diolch. Okay, the next item on the agenda is, I keep on moving my agenda, so please forgive me, is the, thank you, Joe, is the 3-year draft plan for children's services. Andrew.
Sorry, that's me again. I switched off slightly then. Thought I had a break. Okay, thank you, Chair. So if I may just say a few words before we take questions. The paper you've got today provides an update of the work of the Children's and Young People's Working Group that I was tasked with setting up after the board report we brought in September 2020 that identified some of the gaps we had in our service provision, some of the strengths as well, but also some of the gaps we had in our service provision around children and young people's services, and the real desire we had as a health board to develop a more coherent strategy for that important segment of our population. I'm pleased to say the group has been running now for over a year, and with really good representation from across the different services within the health board, which was the prime aim. And I've always been struck since we started by the energy and enthusiasm that the representatives have to come together and work together to try and improve services and develop something of a plan in this area for the local population. We did develop, in response to the planning objective, we had a plan on a page which set a number of milestones for co-producing a service framework. COVID has impacted on our ability to progress that over the last few months in particular. So being mindful that since late August, early September, a significant number of the people involved have been involved in the planning and preparation for the potential RSV wave we were anticipating in paediatrics, which took a lot of their time and capacity from then until the new year. And also just in terms of a number of their planning for a number of their teams to potentially have to be redeployed across some of the children and paediatric services to help manage any surges in demand we saw. So that has seen our progress against the plan on a play against those milestones we had in the plan on page slip. A little has been the case with a number of activities in ops over recent months because of the focus on the COVID. The intention we have remains to have an agreed set of priorities as part of the IMTP planning cycle that will obviously come to board in March, and we have made some progress, I think, on that front as a group. And the next meeting where we'll consider those a bit more fully is actually tomorrow. Tomorrow afternoon. But I wouldn't want the slippage on the plan to kind of be interpreted as that we've made no progress, because I think we have made some progress. I think, as I've said, we've got some really good engagement across the services now. I've talked about the energy and enthusiasm, and certainly in the 4 key areas that have been highlighted so far as areas that they wanted to push forward as top priorities within the IMTP for the coming year. Some of those wouldn't have come about, I think, without the group, because they are examples whereby different services within the different parts of the organisation who are involved in the delivery of children's services have come together and worked out how they can work better together to address some of the challenges we've got. The scheme in particular, priority around working across community and acute paediatrics and mental health and learning disabilities to address some of the ADHD waiting times issues is a really good example of where, without the group, I don't think even some of those conversations would have happened as naturally. So I think that's positive. We have, as a group, also commissioned a review of child psychology services, because we know that's an area where we've got gaps, but we don't really understand the scale of the gaps, and that's due to report at our meeting in February and is being supported by Swansea University. And as we come out of this wave of Omicron now, I'll be connecting with the clinical lead for community paediatrics to discuss how we undertake a review of community paediatric services in a similar vein that we're very keen to progress to help with our planning process. We've strengthened our links with the Children Young Persons Voice group. I'm pleased to say that the senior nurse for community paediatrics is now the vice chair of that group. So we've got some really, and there's obviously a member of our working group, so that gives us a really strong link in. And also the service delivery manager for community paediatrics is now the chair of one of the regional partnership subgroups on children and people services. So we're developing some stronger links as well into those other stakeholder groups. The plan does identify 4 priorities that have come forward so far that the service are keen to progress around: enhancing community children's nursing, as I said, working together to address some of the ADHD waiting times and access challenges we have at the moment, something around specialist public health nursing, and also audiology services. Obviously, they will all need to be considered by the board in the context of the wider IMTP and priorities and how we choose to allocate any funding that we do have available. But I think we're starting. So I think we are starting to make some progress, and I'm optimistic that by the time we come back in March with the plan, there'll be more signals as to where we may want to go in terms of beyond this year and over the next 3 years for other areas of service development.
Many thanks, Andrew. And I know in your presentation you've addressed some of the questions that had been raised before the board. So thank you. I'm going to open up for questions, please. Della. Sorry, Della.
Thank you, and thank you, Andrew. You nearly have responded to the question I was going to ask, really, in your discussion there. The only concern that I may have is pace, and you have explained to me and the board about why and the reasons why it's been understandably delayed slightly up to now. Can you assure me then that your leadership arrangements are really fit for purpose to really drive this agenda forward? And are we going to hear, sorry,
I think you've got problems.
Just in the background, yeah.
Well, can Andrew answer the first bit about leadership, and then you can come in, Della, or type it.
There we are, they finished now,
Yeah.
Sorry about that. And about the leadership and the real drive, and actually hearing from children, young people, and not just the professionals and the adults that are thinking about the services that they have. So sorry about that, it's my builders again.
No problem. Andrew.
No, thanks, Dennis. So in terms of the leadership, I think, as I've said, bringing that group together and bringing all those individuals together into one space is something a bit new for all of them. It's not a way we've necessarily worked as a health board, and there's definitely significant benefit in that. And I think some of the feedback I've had informally from members of the group is that that's a real positive strength of what we've done so far. I think the next stage for us is really for that group to set some really clear areas and priorities for work as well that we want to take forward, and be clear about who some of the leads for those pieces of work will be. And not at the moment, I don't want to get, at this stage anyway, I don't want to get too focused on organisational structure and arrangements that may look awkward in the context of how we're trying to work, because as we know, as we presented in the original report, children's services and young people services are the responsibility for those covers a number of my executive colleague portfolios as well. I'm sure as the work progresses, if the theme of how we can work better together and organise ourselves differently to support some of the delivery of the priorities emerges naturally, then that's something we will definitely look to explore and bring the group on a journey with. What I don't want to do at the outset, though, or too early, is almost present that question as the reason we're together, because that could distract from some of the work and the priorities that we do want to address and take forward. And yes, completely agree with your comment. I think what I really want to get to now is, as we're starting to emerge with what we think are the list of priorities for the service, it's how do we test and cross-reference that back with some of the groups we've got that can, from a children and people's perspective and the voice group perspective, really validate that they're the right things for us to be focusing on. So that'll certainly be something that'll be a next step with that set of priorities that we've identified.
Thanks, Andrew. So as a board, we'll be seeing the what in the planning objectives in relation to children and young people, and then the how can be worked on later. Yeah, okay, thank you. Yes, please.
I know we're pushing time. I just wanted to mention that Andrew's service delivery manager for Community Peds and I attended the Canolban Bandy Appeal annual general meeting on Monday night. Just firstly to put on record our gratitude for this significant amount of money that they've raised, and just to say that we've now made the connection to the work that Andrew's doing through a service delivery manager to ensure that can be used for the best benefit of the children of the Carmarthenshire area.
Excellent, thank you. Judith.
Yeah, thank you. I was most of what I wanted to ask actually Dale has covered, but I guess I just reflect really. Before Christmas, I attended it's like a question time event with children and young people, which the Children's Commissioner had drawn together, which was, you know, they didn't take any nonsense and they certainly didn't want long answers. And I think what I came out of that was actually what are children and young people, and they were mainly teenagers. They just want simplicity in how they access and where they go. And I think I'm really heartened by the progress, but I think it does demonstrate, this report, the complexity we have put into this system. And I think we must just keep reflecting back to those children and young people about how they navigate. And I think that's where the children's group at the regional level is important, to make sure we do that with our partners, but actually to keep it very simple and straightforward, even though behind the scenes it is a very complex area. But for those users, it's really important they can see how they can access what they need when they need it.
Judith, great example to us as board members as well, to follow the children and young people's example, I would say. Just one quick question for me, if I may. One of the pointers about a particular challenge, waiting times for looked after children. Obviously one of the most vulnerable groups that we serve. Is that because of mental health, or is it generally, and you know, I know it's going to be part of the plan?
I think it's generally, but we are working. The teams are working with the safeguarding team to make sure that we clearly identify all of those potential children that may fall into that category, and we can take a more targeted approach to identifying them on any of our waiting lists, and bringing forward any appointments or treatment that we need to expedite.
Great, thank you, Andrew. It's really important because of the consequences if we don't, in placements, etc. Thank you. Okay, so we look forward to seeing the planning objectives in relation to children and young people, and board happy to accept the recommendation. And thanks, Andrew, for all you're doing in this area. So the next item on the agenda is the Integrated Performance Assurance Report. Hugh.
Cadeirydd, diolch. I won't repeat many of the conversations that have been had already, and I'm conscious that Chief Exec and Director of Operations have already alluded to a number of the issues which are highlighted in the report. And I won't go into the report in detail, and that's not to dismiss the challenging read of the report. Clearly, with each of the metrics that we're seeing where we are not performing as we would like, there are people at the receiving end of the services there that are affected. I'm very conscious of that, and we as a board, I know, are conscious of that. Chair, rather than go into the detail, I'd rather just focus on the page 2 of the SBAR, which just highlights the 5 key drivers to the challenges we're facing. And I alluded to these verbally at the last board meeting and thought it helpful to include that in the pack for this board. Clearly, staff shortages are affecting our ability to provide effective services, not least because of absences as a result of isolation or sickness from COVID. Timely discharge of patients is a very significant issue for us, particularly recognising that the 6th of January, we've got the data there, 239 medically optimised patients, 120 ready to leave, and that clearly places a burden on the services that we're providing. Increase in demand being an area of concern, particularly around cancer, I've highlighted there in terms of the referrals that have increased from primary care. And patient acuity, which I alluded to last time, quite a stark increase in the level of acuity that we're seeing there from December 19 at 19% recurring, and level 4 or 5, the highest levels of care, to 28% in December 21. So a very significant increase that's being dealt with there. And of course, space to treat, because of the accommodation challenges that we've already spoken to a certain extent as part of the PPC conversation, but also the additional challenges coming through from COVID and social distancing that we're seeing there. So, Chair, with that, I'm conscious colleagues will have questions on the detail, and I'll open it up.
Many thanks, Hugh. I'm going to bring in John Gannon, please.
Thank you, Chair, and thank you, Hugh, for the report. And I think it is right that I reiterate some of the points that you've made and some of the comments that I put in the chat bar earlier. Reading this report, I'm sure it is uncomfortable for us all. We are acutely aware that behind these figures there are individuals that are in pain and they're waiting for our services, and I recognise we all appreciate that. But if I put myself as a member of the public, I will want to know, when am I likely to be seen? What is the board going to do in order to expedite me being seen and these waiting times reduced? I fully accept that COVID is a significant factor, but if we can be quite clear about our approach, how we're going to communicate that to our public, and what sort of timelines, I'm sure the public will understand that us, like many other health boards, not just in Wales, but in the UK, are facing similar challenges. But understanding what we're doing and when we're going to do it would certainly be helpful to me. Thank you.
Thank you, John.
I was going to come in on that, if I may, John, just because I think there are two different factors in that. One is, as an individual patient, what is your specific conversation with the health board? How are we keeping in contact with you to let you know, A, we haven't forgotten you, and as best as we can in the current uncertainty that we face, expectations about what your individual waiting time will be. Because the work that Mandy's leading around our waiting list support service, which I think does set us apart from many other places, is an effort to try and ensure that we do that on a one-to-one basis. We've got further to go, but that is rolling out quite quickly. I think on the more general, so if you're a member of the public waiting for something and knowing what our plans are more sort of tactically or strategically, that will link very clearly to our discussions around the IMTP and our recovery programme, which we discussed earlier, will also link to the financial settlement that we have and needing to make some judgment calls. So I'm hoping that we will have much more clarity on the broad programme that our Director of Communications can then help us to communicate to the public as soon as we've got that IMTP programme in place. But there is still some work to do to triangulate the money, the staff and the physical resources to do all of that. But I take your point, and I think we all absolutely agree for both of those things. We want to be sure that we're being as clear as possible about what we're doing to recover.
Thank you, Steve. Thank you, John.
Thank
you. Anna, did you want to come in?
No need to come in, Chair. Thanks. Just other than to say that it's a really helpful addition to the report to say to make clear the 5 drivers of our performance as Hugh has done.
Thank you. Any questions? Any other questions or comments? Andrew, do you want to come in?
I think it really, I just wanted to come in and say, I mean, you offered an apology to the members of the population that have been impacted over the last few weeks by some of the changes we've had to make, decisions we've had to take operationally to respond to the latest COVID wave, Omicron. I think I would just want to extend that, because I think one of the things, it picks up on John's point, I think, one of the things that you do realise when you look at the performance report is just the significant impact on people's lives. Some of the difficulty we have in delivering services at the moment is having, and I want to apologise both to all those that are having and experiencing extended waits on our waiting lists, but also all of those that are accessing our services from an unscheduled care and urgent perspective too. We know that there are, you know, some of the waits we've seen for ambulance delays and offload and in our emergency departments for beds, as Hugh's indicated in presenting the report, are at levels that we've never experienced before as a health board, and we are, you know, very, very sorry for the experience that is providing people at the moment. It's not where we want to be. It's not where we hope we'll be in the coming weeks and months as hopefully the situation settles and we're able to start to recover, and some of the actions we've been taking to improve some of our environments. I'm conscious there's work been going on in the department at Glangwili that will complete by the end of March, for example, that will improve our miners assessment capacity and also our majors facility. But I also want to just say thank you to all the staff, though, that I know are doing their very best in some really difficult circumstances. They've had some very challenging periods over the last few weeks and months, but where they've, in particular the last few weeks, where staffing absences, where they've had to cover for each other and work at suboptimal levels of staffing for the amount of demand they're seeing. And I'm equally very grateful to them for everything that they're doing in incredibly difficult circumstances as well. So I guess so just offer that apology to everybody, and I'm grateful at the moment for the patience they continue to give us, but we know as we, our aim as we go forward now is to try and start to address some of those issues and improve the experience for everybody accessing our services at the moment. Thank you.
Thank you, Andrew. I think I know that we all totally agree with what you said, both the sincere apology to our patients and our public, and also to our staff. Thank you. And also, it's really hard for them to not be able to provide the care at the speed and at the quality which they've come into the health service to do. It's a really, really difficult time at the moment. We've got a report here. We could go into the detail of this report, but the actual reality is, as you've just described, which emphasises or highlights even more the importance of the point that Professor Gannon raised about us communicating with the public how and when we are going to recover, as you say, in the context of a financial settlement, and perhaps even concentrating on a few key areas where we know we can do it more quickly, and that will help both the public and staff. So thank you, really appreciate that you've raised that, and we all totally agree with that sentiment. Did you want to comment, Steve?
Well, no, I think Andrew said it absolutely eloquently. We can look at the numbers and see what they say, but it's knowing the reality of that for our population and for our staff. And I think Andrew's apology, I think we would all share.
Absolutely, thank you. So this is, the big name, the integrated medium-term plan, which is, the plan, and how that focuses on recovery, both for our patients and our staff, in the best way we can, is what we will do. So thank you very much. And I note your comments in the chat bar here, and that's fine. Yeah, point taken. Are there any other questions on the integrated report? Okay, thank you. And John says absolutely applaud the commitment and hard work of our staff with dealing with this, and we owe them a duty as well to recover. Thank you. The next item on the agenda is the financial report. Hugh.
Just in terms of the finances, I'll just split this into a couple of sections, if I may. I'll start off briefly with this year, and then just mention briefly next year's position. So for this year, on track to deliver that planned deficit position of 25 million. There is a risk to that, and the risk is probably more around undershooting than overshooting that position at this stage. Clearly a significant amount of recovery work that we are trying to progress, but notwithstanding all the operational challenges, that does place that under risk, which may mean that some of the expenditure isn't incurred, which then has a consequential impact on our outturn. And the other issue to note that is material is the level of annual leave that people haven't been in a position to take, and the assumptions we will have to make at the year end around the liability we need to carry into next year. Those are the two major risks for the rest of this year. There are a couple of appendices attached, Appendix 3 and 4, which I want to reference specifically because they are requests to Welsh Government to fund that deficit formally. Clearly, we need cash in order to fund that deficit, and that requires board approval. We submitted that request pending board approval and we've had the confirmation of it coming through, but I wanted to note that specifically. Going into next year, we've had our indication of the budget allocation, and it's a challenging outlook for us. In any normal year, I think we'd be looking at this and thinking it was a very healthy uplift on our baseline projection. However, I think there are a few issues that make this a very challenging settlement for us. The first issue is we are facing some quite significant inflationary headwinds. Utility costs is one example of that, but one of a number of examples. We also have the challenge of the savings that we have not been in a position to deliver for a couple of years now, and that has a big impact on our underlying deficits carried forward. And lastly, some of the expenditure we've been incurring as part of our COVID response. We've now been incurring some of that level of expenditure for 2 years, and to a certain extent, it has become embedded in the way in which we operate our system operationally and clinically. And actually extricating ourselves from some of those decisions will be a challenge for us and will present us with some challenging choices. I'm not going to propose to go through any figures in detail at this stage, too early, but we will come back to that in a future board meeting and have that conversation then. But I just wanted to highlight those key concerns that I've got at this stage. So, Chair, with that, I'm happy to open for discussion.
Many thanks. Winston.
Thank you, Chair, and apologies if there's any difficulty hearing me because I've had some trouble with my IT at this end. Hugh, thank you very much for your reports. I just want to say to IAMS and the board and the public that Hugh's reports and the assurance we get from Hugh and his team is excellent. We in between board meetings we have a sustainable resources committee where we look at the information, and he's really reported quite consistently on the financial position of achieving a 25 million deficit. In many ways, it doesn't reflect some of the efforts that's gone behind this, but I think we've heard in other parts of the board agenda today about the operational issues that we're facing. First thing I want to say is I completely support the strategic cash support that he's put in the 2 appendices. That absolutely makes sense to us, very clear about why we'd want that strategic support in the appendices, so fully support that in what Hugh's saying here. Also, in addition to that, there are some changes to the financial scheme of delegation. We've seen those and looked at those in the Audit and Risk Committee and fully supportive of those. They also make sense in order that the organisation can do what it needs to do in these circumstances. The things I just want to really reiterate, which it's a very consistent thing, is about our ability to ensure that we make recurrent savings. We're able to identify the savings non-recurrently and actually take them out non-recurrently. But I think given what next year looks like in reduced funding, which he's alluded to, and these also alluded to earlier, and what that looks like going forward, I think it's really important that we put our minds together and think about what it will take for us to convert non-recurrent savings into recurrent schemes. I don't think it's easy, because it's not, but I do think that it's an area of focus we need to really think about going forward. And I think that those were just the main comments I had on the report, but everything in here is extremely consistent with what we've heard earlier. He's identified in his paper a risk around the capital resource limit, which again we've already discussed and seen at the SRC committee. So that's all the things I was just really highlighting at this point, Chair.
Thank you, Jock and Val. Winston.
Chair, I'm happy to come in just to respond. Yes, the challenge of savings will be a significant one for us. I guess before we even get there are choices that we have to make in terms of our investments and how we allocate our resources. But yes, there are certainly opportunities that we now need to pursue, and we're working on those as an executive team. One thing that was very heartening in the allocation which came out was the significant increase in funding for social care. And I think there is a conversation we need to have pan system that broadens out from health in terms of the benefit of that investment in social care and whether that will make some inroads into some of those issues are highlighted in the performance report, that and in terms of delayed discharges and increase in referrals. So there may well be a pan system benefit we see from that investment.
Many thanks, Hugh. Jill, did you want to come in?
Yeah, just very small points, please. And it's been a helpful report, but just it was in the commentary around some of the savings. It's a presentational issue which I've picked up outside of the meeting, but there is a reflection on page 2 of the SBAR that some of the savings haven't been able to be operationalised or maximised because of lack of access in primary care, manifesting in significant A&E demand. So just wanted to reflect there from a service perspective. I am getting some clarity on that because of course primary care has been open throughout COVID and is seeing increasingly significant demand itself. So I'm sure it's just a presentation issue, but I wouldn't want members of the public to think that, you know, primary care hasn't been available to offer the services it needs to. So I'll look at that a little bit further. My second point was in the revenue summary, and there are a couple of comments where it states that the mass vaccination costs have been offset by slippage in dental contracts. So again, just trying to seek some clarity outside of the meeting in terms of that, because as we know, throughout COVID, we have had to pay dental contractors at 90% of their contract value, regardless of the fact that they only achieve 40% of their contract performance, whereas in previous years we've done a lot of work around recovery in terms of failures to achieve contract levels of performance. So, and with the remaining 10%, of course, we've had to invest that in some of the urgent dental access. So again, seeking clarity outside of the meeting, but just wanted to raise that as a point at this stage.
Okay, thank you, Jill, and I'm sure that'll be sought outside the meeting. Many thanks. Are there any other comments at all? Okay, thank you. The board happy to ratify the changes to the scheme delegation and also to ratify the strategic cash request approved by the Sustainable Resources Committee. Yeah, thank you. Thank you, Hugh, for the clarity of the presentation. Many thanks. So the next item on the agenda is Hugh again, the use of consultants.
Yes, Chair, I'm afraid you don't get rid of me. Thank you. I've got a report here that brings together some of the proposals to go outside the organisation to use some external support. And these are to drive forward our objectives that we already have harder and faster to a certain extent. And I'm happy to go through them individually to give a sense of assurance on the process that we've gone through. This will be a fairly new departure for the board to receive these at this level, because according to a scheme of delegation, in terms of contracts at this level, they could be signed internally by the executive team. But because they are consultancy contracts, they need to come to the board for approval. And that's an issue that was picked up by internal audit, and we've rectified, hence this report. The first one is the palliative care strategy. That's the second part now of developments that we've been going through for quite some time, and will allow us to accelerate the implementation of the palliative, or development and implementation of the palliative care strategy. And I think really does speak to a number of strategic developments for us as a board, and will help us certainly with that objective to look after patients going through that pathway. The second two items, the frailty identification and developing a virtual hospital model, are both items which we developed some thinking of within the Health Board, and in discussing this with colleagues in Welsh Government and in Digital Healthcare Wales, there was an appetite to fund these from central funding opportunities to allow us to accelerate these items as of a pathfinder, a pilot within our Health Board. The values are significant, but I want to give the board assurance that these are funded through those external sources. And the last item, it's a fairly minor sum in the scheme of things, but is important for us in developing a new fee structure for long-term care and our commissioning arrangements with care homes. So I think could be a transformational opportunity for us if we get that right.
Are there any questions from members? Judith.
Thank you, Chair. Yes, my question relates to the last point, Appendix 4. I'm a little bit puzzled about this one, actually, I have to admit, in terms of there's no reference to a link with local authorities about this, also about any work going on at a Wales level around the whole area of funding community health, continuing healthcare, and also just confirmation this does include all our mental health and LD placement charges as well. It wasn't clear, but I was just puzzled that I know there's an issue, but why we were doing it simply as the health board.
Yeah, thank you. No, this was a piece of work that was originally envisaged between us and local authorities, and Ceredigion have already joined us in that, and the other two local authorities are considering whether they join in that review. I'm not sure. I think they may have indicated that they are able to join now, but that was earlier this week. And Jill, you may have an update on whether they're in that position to join us.
Yes, if I may join, and just in terms of the wider context of the question that Judith asked, this is very much in the national strategic framework as well, Judith. There are a series of national meetings that look at continuing care, and I also chair the complex care leads management group across Wales in that respect. In terms of continuing care and fee modelling, it's something that's been in our local plan for a very long time in a partnership space, and due to historical issues and legal challenges, each local authority has an individual model, and we've talked many years, actually it's been a bit delayed, over the need to actually look at a consistent framework across our three local authorities and the health board. So our finance colleagues have led on that, and Sean this week took the paper to our integrated group for that discussion to engage other partners. Originally Ceredigion were in the space, as Hugh said, of having made that agreement, and whilst Pembrokeshire and Carmarthenshire feel at this point that their model is robust, what they see is the benefit of actually exploring the framework and the principles through that joined up conversation to allow them that opportunity to review their current model against that as well. So very much want to engage in the work. It may not lead to a single model yet across all four partners, but it's certainly something that we're doing together.
That's very helpful. Thank you for that clarity and assurance.
Thank you. I'm just going to remind members as well, we are running over time a little bit, so if we could be concise in our questions and concise in our answers, it will get through the agenda a wee bit quicker, and then the trustee meeting and the in-committee board. Gareth.
Thank you, Chair. Yeah, exactly the same theme, but on Appendix 2 of frailty identification insights is assurance, really, especially as it's externally funded, or whether that again is in partnership with primary care and social care in particular. And does it fit into other digital platforms? For instance, I'm thinking of Delta Wellbeing, for instance. So is this a joint approach, or is it purely an internal health project? Thank you.
Chair, happy to assure you that it is a joint approach. Delta are involved, Shirgar are involved. Clearly, primary care contractors are independent, but there's an opportunity to bring primary care into this as well, and where we can, we certainly will. The more data sources we get into this, the more robust the model will be. So we'll certainly use this. It would be incremental, it'd be developmental over an 18-month period, I'm sure.
Diolch.
Can I bring in Jo?
Yes, Chair, and I'm just thinking about the terms of governance and timing of board and having these discussions, and I'm just wondering, to do with the ALAC Chair, whether it would be appropriate to ask going forward whether we do the scrutiny of the consultancy through the audit committee, which would give more appropriate time to have some of these conversations if the Chair. So just on this, on a second point, just on the Delta, obviously Councillor John would need to declare an interest in that being a manager councillor as well. Okay, so just to the Vice Chair, thank you.
Yeah, apologies, thank you. Thank you.
So we defer this to Paul. Paul, are you happy with that?
Yeah, I'd certainly be happy with that, yes.
Thank you. Will that cause any problems with delay?
You know, because the audit, sorry, Chair, I want to speak then, I jumped in. As we meet, the audit committee meets the alternate members to the board, so we could do the scrutiny in the audit committee and then the ratification at the board.
That's much more appropriate. Thank you. Hugh, you're looking confused.
He just wants to check with these consultancies, I think, Hugh.
Chair, I'm just checking on the timing of this, whether we're content to approve this here, recognising that we can put in place the scrutiny arrangements into audit committee as well.
Does mean if we approve these as a point today, and then moving forward the governance, we look at how we can strengthen that to enhance scrutiny going forward.
Yeah, it is more appropriate. Is the board happy to approve these consultancies? Take that as a yes. Yeah, thank you. You know, I cannot wait for us all to be in a room together.
I know.
I'm not talking to a screen, so thank you for that. Okay, the next item on the agenda is strategic enabling group. Again, we've read the paper, so only talk to the papers if there's anything specifically you wish to draw to our attention. Hugh.
Chair, I don't need to speak to the paper, but I am proud to be able to bring to you a proposal here, which will be a programme of digital inclusion. And as we move to a more digitally enabled health system, I think it's absolutely important that we support those least vulnerable and least able to use digital connectivity in that journey. So that is a point of principle that I am keen to note as a board and work on the plan going forward.
Absolutely essential, Hugh, particularly now that we've approved the business case as well. Steve.
I just wanted to mention, Hugh, probably, sorry, I didn't mention this to you the other day, but the chair and I met with AIDS Cymru David, and they were describing to us some of the work that they already do to help people to access digitally. They've got people out there who can train and support. So I did say we would make those connections because of our agenda. So we'll pick that up outside of the meeting. But I think it was a really interesting discussion with them. I'm glad they're out there doing the work they do.
So thank you. I think we're very proud to adopt that charter. Making it a reality is the challenge, and we intend to do that. Any questions? No. Yeah, absolutely, Hugh. Any questions at all on this particular? Are you coming on this one, Maynard?
The next one.
You ready for the next one?
Item.
Okay, thank you. So is the board happy to accept the recommendation, which includes supporting the development of the digital inclusion programme and the charter once reviewed? Thank you very much. Thanks, Hugh. Next item is Maynard, the reviews of your committee.
Yeah, in the interest of time, I'm not going to repeat anything. Nothing has changed really since the paper was written.
Many thanks. I've got one question on your paper actually, which isn't for you to answer, but what are we doing about the bridging service by the end of March?
Gillian.
Jill?
Yeah, yes, thank you. One of the things that we committed to do was a review. So that review is underway and is going to be presented to IAG, we hope, on the 14th of February. But what we're then trying to do anyway in the meantime, but Bridging Care would be part of a wider piece of work as it is to look at a home-based model of care so that we're not looking at Bridging Care in isolation. So there's a lot of work going on through the integrated partnership arrangements to bring together all of the activities that have been going on in this space. And I think that will also inform in the workshop as well that we're talking about for April in terms of Dom Care Imagined going forward. So Bridging Care again would be considered in that context. And I think we need some wider plans then going forward.
Many thanks, Jill. Looking forward to that.
It's a bridge to somewhere.
Yeah, absolutely. Well, it is a bridge to somewhere. I'm really looking forward to the somewhere. Any other questions or comments? No, thank you, Maynard. Next is the report of the People Committee. John.
Thank you, Chair. This report is of our meeting on the 13th of December. There are no matters that require board level consideration or approval. There's one item there that's noted as a risk, which is being dealt with. Other than that, I'm happy to take questions on the content of the meeting.
Many thanks, John. Any questions for John? No, thank you, John. So I've just come in for the next one. Thank you very much, John. Next is the report of the Health and Safety Committee. Judith.
Yeah, thank you, Chair. Again, nothing to particularly refer to in the report. If I move down to the risks, there are two there which we are continuing to explore, but I think this does show us that because of all the activities of the team under the leadership of our Executive Director of Nursing, having dealt with all the health and safety executive enforcement notices, they are now being able to be proactive in examining where risks might lie and address them before we have any enforcement notices, so the Chief Executive can breathe easier.
Thank you.
Thank you, Judith.
And our patience. Thank you very, very much. Any questions on this? It's good to see the progress, Judith. Thank you. The next is the report of the Sustainable Resources Committee. Winston.
Hello, good afternoon. I think the report really stands for itself. It just reinforces two things: the emphasis on savings to be made recurrent, and we looked ahead at the challenge going into next year in relation to the settlement. So there's nothing more to add, to be honest. It happened in December, and actually part of the meeting we did have a seminar afterwards where we explored other areas such as value-based healthcare commissioning, value-based healthcare costing. We looked at some I think it was sustainability areas, and it was a different way of engaging the committee and the organisation. But no, I think this committee gives quite a bit of assurance to the board in relation to the financial position. And as I said, I just remarked on the efforts and the professionalism of you and this team.
Many thanks, Winston. And we concur with that, as do Wales Audit Office, which is wonderful. Any questions? Okay, many thanks. And then the committee reports. Does anybody want to raise anything on the updates?
No, Chair, just in relation to charitable funds, we need to have a trustees meeting to approve the 3 items that are detailed in the SDAR, Chair.
Are we having that after in committee or before?
Directly after this, so we can stay live streaming, Chair.
Super, thank you. The next item on the agenda are the joint committees.
Happy to take questions, Chair.
Any questions on the joint committees report? Okay, thank you. And then next is the board annual work plan. Any questions on that? Jill, were you trying to come in?
No, sorry.
Okay, no problem. Okay, many thanks. That concludes the public board meeting. We're going to go into a trustee meeting. So I hope members of the public who have joined us stay, because it's one of the heartwarming meetings where we see where our money has been spent and received. So I'd like to conclude this meeting now, and the next meeting will be on Thursday, the 31st of March. And I'd like to sincerely thank everybody, executive and independent members, and all our staff for all they're doing. Thank you very much. Should we go straight into the corporate trustee meeting? And then we'll break after that for the in committee. Any apologies? Same as in public board. Thank you. Any declarations of interest? Okay, if we go into the item 2, the corporate trustee session, which is the ratification.
It is, yeah. I think we've got Delic with our territory from Sarah.
Delic, over to you.
Hello, diolch. Prynawn da. You've all have had a chance to look at the papers, and I just welcome the opportunity of presenting this very, very brief session, but actually to really thank our public and our communities as well, that they have come out in their droves and they have supported us through some very, very challenging and difficult times for them themselves. And I think the annual report just illustrates that impact that those charitable funds make to the lives of our patients and our staff. So I'd like to take this opportunity of saying diolch yn fawr I pob un. So Chair, I hope you'd indulge me in that. I know we're stuck for time, but I think it does need to make note that our public have supported us brilliantly. So I'm actually so proud and privileged to be chair of this Charitable Funds Committee, and there are two items that I'm asking the board to ratify as as delegation responsibility, and that is because that we are asking to release funds of over £100,000 from our fund. So Joe will help me on that as to the wording of it, but I think I've hit the nail on the head. And it does say there in the recommendation that we would like to release 180,000, well, just over nearly 181,000 from our charitable funds for creating rest areas for our staff of Hywel Dda, and then 228,000 over the next 3 years to support phase 2 of the CAPS project. I don't know if Mandy needs to come in to reiterate what that is, but it's the psychological support for people affected by cancer and the workforce. So I'm unless Mandy wants to come in and say anything more.
I was just going to say what an excellent job you've done of selling the requirement, Delith, because I think it's fair to say that all the services are absolutely committed to driving this forward. And as you say, thanks to the public for enabling us to be able to hopefully endorse this expenditure.
Yes. Thank you, Mandy. And I apologise for that weird noise that's coming through. Well, maybe you can't hear it, but I can hear it. But and hopefully the board will also approve the our annual report and the accounts as well. So those are the 3 that I'd like to draw your attention to.
Thank you very much. We've got some comments that in the board, people totally agreeing with the way you thank the public, and we'll reiterate that as the trustee. Absolutely support the rest areas and do the recommendations. So the board happy to ratify the release of those funds for those really important projects. Yeah, thank you very much. And any questions on the annual report and accounts or any comments?
I note Paul's comment about moving more quickly to provide funds for items like this. I think members will agree with me that as a committee, we are really looking at ways that we can really speed up this process for our staff in particular in actually releasing funds. So thank you, Paul, for mentioning that, because I think as a committee we've moved on very well in the last year and a half to actually think of innovative ways of actually helping our staff to go through the paperwork and improve. So thanks. Thank you.
I think we do. Thank you. I think we all agree with that. We want to spend what we have donated to us. Yeah, Winston's saying loving the annual report, diversity of age, people very uplifting. The annual report is really heartwarming, and it's lovely to see what the members of the public of all ages and diversity, how they've gone the extra mile to raise funds for their local NHS, and also how staff have done the same thing as well as working. Yeah, absolutely wonderful, and it's presented in such a good way, so thank you. So is the Board of Trustees happy to ratify the charities annual reports and accounts for 2020-21? Many thanks, Diolch yn fawr. Thank you, Delith, for chairing this committee. And so we will now have a 5-minute break before we go into in-committee. So thank you very much, and that's the end of our public session. Diolch.